Thank you. We may be seated.
Honorable Minister, Dr. Douglas Mumbeshora, the Minister of Health and Child Care for the Republic of Zimbabwe, our distinguished guests and delegates, you're welcome to the 4th Annual Reproductive Justice Litigation Baraza 2026 in Harare. We are here to continue the conversation around the Baraza, and it's a conversation that began 4 years ago, and each year we've been having a Baraza. Nonetheless, we have conveners that have curated this space and have taken a whole year preparing since the last Baraza. I'll take the opportunity to invite them here to do their welcome remarks. Please put your hands together to welcome Godfrey Mudariki of Wilsa. Let's clap until Godfrey takes his seat. They've done a lot of legwork. These are difficult times. Getting such a convening together in person is no mean feat. Then we have Maria Chiwera of CWGH. When you clap your hands, you're going to warm up. I know we are cold. Then we have Lenny Sharon Pamela of Ahaki. Okay. And then we have our Honorable Minister of Health and Child Care of the Republic of Zimbabwe. Clap hands that are for our chief guest. So let's put our hands together to welcome our chief guest, the Deputy Minister of Health, Honorable Suleiman Timos Kwindini. He's a member of Parliament. Like he's popularly known in Zimbabwe, he's called Honorable S.T. Kwindini, who joined the Ministry of Health and Childcare in 2002. And he's trained as a general nurse in 2006. He has worked with the Ministry of Health and Childcare as an RGN from 2007 to 2023. During his tenure in the ministry, he has acquired a Bachelor of Science honors in HIV and AIDS and a Master's in Public Administration. He also became an active politician since 2016 and became a member of Parliament for Chiundura constituency in 2023. He was appointed a Honorable Deputy Minister of Health and Childcare in January 2024 and is the current Deputy Minister of Health and Childcare and is here to represent our minister and also have deeper conversations with us. You're welcome, Deputy Minister. So now I'll hand over to Geoffrey to give us the welcome remarks and why we are here.
Thank you very much, Chair. Honorable Minister, Deputy Minister, Honorable S.T. Kwindini, good to see you. That's my honorable. I actually hail from Gweru, and it's a pleasure to be sharing the stage with my honorable MP. Distinguished guests, members of judiciary, legal practitioners, academics, representatives of civil society organizations, development partners, colleagues, ladies and gentlemen, welcome. On behalf of the Women in Law Southern Africa, Zimbabwe Board, Leadership and Governing Board, I would like to, I'm honored to warmly welcome you to the 4th Reproductive Justice Baraza, Litigation Baraza, the first to be convened outside Uganda, here in Harare, Zimbabwe. As a country and an organization collective, we are privileged to host the global presence of jurists, advocates from Zimbabwe, South Africa, Uganda, Rwanda, Malawi, Kenya, USA, Senegal, Uruguay, Chile, Brazil, Jamaica, and last but not least, Colombia. Today, as we enter this space is intentionally designed to facilitate rigorous legal inquiry, strategic solidarity towards attaining mutually agreed evidence-based actionable policy priorities that will break barriers of access to health in our common pursuit and goal of attaining universal health coverage. We are privileged to host this convening with the Community Working Group on Health and the initiative funder, Afya na Haki. As we do so, this year's theme, Age as a Determinant of Sexual and Reproductive Health Rights, invites us to confront how age shapes across access to information, autonomy, healthcare, justice across the life course from adolescence all the way up to older age and adulthood. So age, as we know it, does not operate in isolation. It intersects with gender, disability, poverty, geography, social norms to create layered barriers to the full enjoyment of sexual and reproductive health rights. These barriers are not natural. They are constructed through laws, policies, institutional practices, and therefore can also be dismantled. The fourth Baraza builds on the resolutions and the frameworks of its predecessors, the three first held in Uganda, including the African Charter on Discrimination of SRHR, adopted in Kampala in 2025. Over the next 4 days, we will examine age as a structural determinant of SRHR and interrogate the legal architecture of exclusion, as well as develop regionally grounded litigation strategies that ensure no age and no one is left behind. At WILSA, we believe the law is a living instrument for social transformation, strategic litigation, when combined with research, movement building, and community mobilization, can reshape jurisprudence, influence policy, affirm dignity. The session I had from the youth-led moot to discuss on mental capacity, sovereignty, and older persons' rights, they reflect on our shared commitment to build a life course framework for reproductive justice. The diverse representation here from Zimbabwe and all the countries mentioned earlier on, together will explore how continental instruments such as the Maputo Protocol, the Banjul Protocol, the African Charter on Rights and Welfare of the Child can be deployed to dismantle age-based barriers and advance jurisprudence rooted in the localized values of dignity. As we deliberate, let us engage openly, challenge assumptions, center the lived experiences of adolescents, young people, and older persons. The outcomes of the Baraza, the Harare Principles of Age and SRH, and the joint submissions to the African Committee of Experts on Rights and Welfare of the Child must translate to our discussions into actionable commitments that influence law, policy, and judicial reasoning across the continent. I extend heartfelt appreciation to Afya Nahaki, the Community Working Group on Health, and all partners whose dedication made this convening possible. To our distinguished guests, the Deputy Minister of Health, thank you for making time from your busy office and national schedule to be with us today. To our international guests, may you experience the warmth, the hospitality, the resilience that define Zimbabwe. And if you have time, do make time to visit one of the greatest wonders of the world our planet has to offer, Musia Tunya, the Victoria Falls. With those remarks, I welcome you to the fourth Baraza, the fourth Reproductive Justice Litigation Baraza 2026. May our deliberations be fruitful, our collaborations enduring, and our commitment to reproductive justice unwavering for present and future generations. And in ending, may I finish with the following two proverbs. One, chirere chigokurerao. In vernacular, it means take care of a child so they can take care of you when you get older. Then the second one is aive madziva ave mazambuko. And I can get someone to translate to Ndebele and other vernacular African languages later on. Those that were once dams are now possibly rivers that we can now cross over. Translating to, you are now healthy as an active, energetic adult, but at some point in time you will grow to become an elderly. You will need systems and people that will take care of you. With those few, I thank you. Over.
Thank you very much. We'll now invite Maria from the Center, Community Working Group on Health, to come and give us her welcome remarks.
The Honorable Deputy Minister of Health and Child Care, ST Kwidini, Honorable Chief Justice Elizabeth Kwaunza, who is in absentia but will be joining us later this evening. Dr. Brenda Akia, who is the Vice Chair and Rapporteur, UN Committee on the Elimination of Discrimination Against Women. Honorable Janet, African Union Special Rapporteur on the Rights of Women in Africa. Dr. Leng Mofokeng, our Kenyan speaker, members of the judiciary and the legal profession, members of parliament here present, civil society and youth-led organizations, Baraza conveners and co-conveners, distinguished guests and delegates. Good morning to you all. Good morning. Thank you. On behalf of the Board of Community Working Group on Health, Executive Committee, the network members, and the Secretariat, it is my greatest pleasure to welcome you to the 4th Annual Reproductive Justice Litigation Baraza. We are honored to host delegates from across Zimbabwe, the African continent, and beyond. And we really thank you for joining us for this important gathering. This year's Baraza marks a significant milestone. For the first time since inception, the Reproductive Justice Litigation Baraza is being held outside Uganda for the first time. And we are proud that Zimbabwe has been chosen to host this historic event. It is also a privilege to convene this Baraza through the partnership between Community Working Group on Health, Women and Law in Southern Africa, and Afia and Haki, reflecting our shared commitment to advancing sexual and reproductive health and rights through collaboration. To all our regional delegates, I extend a warm Zimbabwean welcome to Harare. We hope your time with us from yesterday to the 6th of August 2026 is both productive and memorable. Allow me to express my sincere appreciation to the Honorable Deputy Minister of Health and Child Care for officially opening this year's Baraza. And I should also add here that as Community Working Group on Health, we have a standing memorandum of understanding with the Ministry of Health and Child Care, which is something very important. Your presence, sir, affirms government's commitment to dialogue, partnership, and strengthening our health system. I also thank the Law Society of Zimbabwe, our development partners, and every institution whose support has made this gathering possible. Our theme, Age as a Determinant of Sexual and Reproductive Health and Rights, reminds us that people experience barriers to health differently throughout their lives. As we deliberate over the coming days, our focus must extend beyond identifying challenges to developing practical, sustainable solutions. To strengthen sexual and reproductive health and rights, we must address persistent bottlenecks by expanding access to quality services, particularly through primary health care, revolving financial barriers, strengthening health systems, and ensuring respectful, person-centered care. We must also review outdated laws and policies so they reflect present realities, embrace innovation, and respond to emerging challenges. Equally important is ensuring that existing laws are fully implemented through adequate financing, strong accountability mechanisms, public awareness, and equipped justice sector. The Community Working Group on Health remains committed to promoting equitable access to healthcare and strengthening community participation, because lasting progress is achieved when governments, health professionals, lawyers, researchers, communities, and development partners work together. I encourage each of us to engage openly, learn from each other, and leave this Baraza with renewed partnerships and practical commitments that will advance health, dignity, and justice across our region. I wish you productive deliberations and successful conference. Welcome to the 4th Annual Reproductive Justice Litigation Baraza, and welcome to Zimbabwe, our home and rich country. Thank you.
Thank you very much for the warm welcomes. I'd like to invite Sharon Lenny from Ahaki to welcome us.
The Honorable Commissioner Janet Ramatulai Salanje, the Special Rapporteur on the Rights of Women in Africa, the Honorable Vice Chair and Rapporteur of the UN CEDAW Committee, Professor Robert Nanima, a member of the African Committee on the Rights and Welfare of the Child, the Honorable Deputy Minister of Health and Child Care of Zimbabwe, members of the judiciary from Rwanda, Malawi, Uganda, and Zimbabwe, members of law societies from the different countries represented here, distinguished guests, partners, colleagues, and friends, good morning. As we begin this Baraza, I would like us to reflect on a statement that history always bends towards justice. And while we ponder on that, I would like us to think about Ngozi, a 16-year-old with 2 children. After the death of her father, is now the head of her family. She is trusted to make household decisions. But when it comes to her body, the law suddenly decides that Ngozi cannot decide. The same law that could not protect her from poverty, early motherhood, grief, draws its firmest boundaries around her own body. Ngozi's story belongs to a longer story for the African people. But Africans have repeatedly insisted that injustice is not natural and it's not permanent. That means that we can work towards justice. And reflecting on the statement about the arc that bends towards justice, Africans have always rejected colonial domination and demanded independence. The arc also bent when we insisted that freedom required the decolonization of laws and institutions, and that's why we have African institutions represented in the room. And it also bent when women on the continent insisted that we are not as free while our bodies and futures remained controlled by others. And this struggle has found its most and clearest legal expressions in the Maputo Protocol, the African commitment to dignity, equality, bodily autonomy, and reproductive autonomy. And the Maputo Protocol is not the only normative framework that Africans have come up with. We have frameworks on older people. We have frameworks on the rights and welfare of children. We have frameworks on people with disabilities, to name with a few, but a few. But history cannot bend itself. All of us in the room have to contribute to that. And that is why we are at the Reproductive Justice Litigation Baraza. And this word Baraza was borrowed from our Kenyan colleagues. I know Kenyans are represented in the room. Kenyans, can you wave at us? Yes, I see some. I see Nyokabi, among others. So the Baraza simply means conversation or gathering. So in this room, we gather across disciplines. We have judicial officers, we have members from the communities, we have civil society, we have policy makers, and all of us are converging under the theme, age as a determinant for sexual reproductive health and rights. So let me take you back to the story of the Baraza. We've had 3 so far, and this is the 4th. The first happened in Uganda. It created the space for such conversation. And for the first, we focused on an Afrocentric framework on reproductive justice. After the first, we went to the second Baraza, where the people that gathered there said, we need to have a space where we convene and continue this conversation beyond a 3-day event. And there we launched the Africa Reproductive Justice Litigation Alliance. I know the chairperson of that alliance is also represented in the room, Ms. Molly Nkosi. For the third Reproductive Justice Litigation Baraza, we thought about a strategy on how we push forward the deliberations that we're making. And at that time, we had a lot of pushback on sexual reproductive health and rights. And so we came up with the Kampala Charter on ending discrimination and decriminalization of sexual reproductive health and rights. Now we have the Reproductive Justice Litigation Baraza, the 4th. The first time it's convening in the warm Zimbabwe. I must say the people of Zimbabwe are really, really warm. And we have had a very good time. So back to the theme of the Baraza. Across Africa, age can determine whether someone is heard or silenced, received health care, or is turned away, or has their consent respected or replaced by another person's decision. Now back to Ngozi. She's considered old enough to become a mother, care for 2 children, and carry household burdens. But when she seeks contraception, treatment, support concerning pregnancy or its termination, she is suddenly considered too young to know her own mind. The irony. Yet the Baraza does not stop with Ngozi. It also reflects on other people, older persons, and I would like to use Tatenda for this. Older persons have disappeared from reproductive health laws, policies, and services as though dignity, sexual reproductive health, and bodily autonomy expire with age. They do not, I would like to affirm. So as we deliberate and reflect on this Baraza, I hope that we know that change is possible and every one of us in the room has the ability to cause change in all the spaces that we are in. And this is already happening. Judicial officers represented in the room are delivering progressive jurisprudence. Lawyers are taking cases for public interest in courts. Communities are no longer silent. They are empowered enough to speak for themselves and their rights. But as the days go ahead, I hope that we will speak about constitutions, statutes, treaties, lived realities, remedies, but I hope that we remember whom these are meant to serve. So let Ngozi, Tatenda, and everyone that has been marginalized and has been placed on the sidelines of our work be recognized and be at the center of these conversations. And with that, on behalf of Afya na Haki, and on behalf of the Community Working Group on Health and WILSA, who have convened this marvelous conference, we welcome you, and let's begin the conversation. I also have the honor, the distinct honor of inviting the Honorable Deputy Minister of Health and Child Care to come and share his remarks. Honorable Minister, I yield the floor to you.
Thank you. Pray, be seated. Thank you. I no longer know the moderator, which one is now the moderator, but let me say thank you to the first one. Hope she's going to create a favorable ground. During World Cup, we were given hydration break. I don't know the temperatures in here. What are you going to offer us? Because it seems to be very cold in here. So hopefully you are going to give us a warmth break after my deliberation or after my speech maybe. Thank you. The Honorable Chief Justice Elizabeth Kwaunza, in absentia, as she will be joining the dinner event later this evening. Dr. Brenda Akia, Vice Chair and Rapporteur, UN Committee on the Elimination of Discrimination Against Women. Honorable Janet, Africa Union Special Rapporteur on Rights of Women in Africa. Dr. Tali Mofokeng, our keynote speaker. Members of the judiciary and legal profession. Honorable members of parliament. The civil society, including youth-led organizations. Baraza conveners and co-conveners. Distinguished delegates, good morning to you all. As we all are aware of the theme for this year, age as a determinant of sexual and reproductive health and rights. It is my great pleasure to welcome you all to Harare for the 4th Annual Reproductive Justice Litigation Baraza. It is an honor for Zimbabwe to host this important gathering for the first time, bringing together policymakers, members of the judiciary, legal practitioners, parliamentarians, health professionals, civil society, academias, development partners, young people, and communities from across the region. I commend the Community Working Group on Health, Women and Law in Southern Africa, the Law Society of Zimbabwe, AFIA, Nahaki, and all partners for convening this virtual dialogue. Your commitment to advancing reproductive justice through collaboration between the health and legal sectors is both timely and commendable. This year's theme, as I said earlier on, age as a determinant of sexual and reproductive health and rights, reminds us that these rights are not confined to one stage of life. Age influences health needs, access to service, and the barriers people encounter throughout their lives. While much attention is rightly given to adolescents, we must recognize the needs of adults and older persons. Reproductive justice is a life course issue, and our policies, laws, and health systems must respond accordingly. The government of Zimbabwe remains committed to ensuring that every citizen and permanent resident has access to equitable, affordable, and quality health care through the primary health care approach. We continue to strengthen health infrastructure, expand community-based services, improve digital health systems, invest in our health workforce, and ensure the availability of essential medicines. These investments are producing measurable results. Zimbabwe has reduced maternal mortality from 651 deaths per 100,000 lives births in 2015 to approximately 212 to today. This achievement reflects sustained investments in emergency obstetric care, skilled birth attendants, and strengthened community health systems. While we celebrate this progress, we recognize that every preventable maternal death is one in too many, and we remain committed to further improving outcomes. We are also transforming service delivery through initiatives such as the Together for SRHR initiative, Zimbabwe is advancing integrated people-centered care by bringing sexual and reproductive health services, HIV prevention and treatment, and services for survivors of sexual and gender-based violence under one roof. This approach has improved efficiency, reduced waiting times, and enhanced the quality of care for the people who we serve. Recognizing that adolescents require tailored services, government has strengthened adolescents-friendly unity health service through national standards that promote confidentiality and dignity. More than 5,000 healthcare workers have been trained to provide respectful, youth-friendly care, helping to reduce bias and create an environment where young people can seek services with confidence. Beyond our health facilities, we work with communities and traditional leaders through initiatives like that the Not in My Village campaign to address child marriage and early pregnancies. Mobile outreach services are also bringing essential health care closer to rural communities, ensuring no one is left behind as our president's mantra that no place and no one is going to be left behind to achieve Vision 2030. While we acknowledge this progress, we must be honest about the challenges that remain. Too many young people still face barriers to access timely services. We recognize the ongoing discussions around age-related legal provisions governing access to family planning. As government, we remain committed to ensuring that our policies protect children while enabling them to access the information and health care needed, guided by evidence and the best interest of the child. This has been evidenced by the Medical Amendment Bill, which had 11 clauses, and that out of 11, 10 excelled very well, while we're still looking into the 11th one. Adolescent pregnancy remains a significant concern, with nearly 1 in 4 young women giving birth before the age of 18. Addressing this requires a coordinated response extending beyond health to include education, social protection, and the meaningful participation of young people themselves. At the same time, we must ensure older persons are not overlooked. Health aging includes access to cancer screening, management of menopause, mental health services, and protection from abuse. A truly inclusive system responds to people's changing needs throughout their lives. We must also pay greater attention to those experiencing multiple forms of exclusion, including people living with disabilities, those in remote communities. Zimbabwe's health care system also faces challenges associated with shortage of skilled health professionals due to migration of experienced personnel. We remain committed to strengthening the health workforce through retention strategies and supportive working environments. We also recognize that sustainable progress requires increased domestic investment in health. Distinguished guests, the presence of members of the judiciary and the legal profession at this Baraza reflects the important relationship between health and law. Laws shape access to healthcare, while evidence from the health sector informs stronger legislation. When policymakers, health professionals, legal practitioners, and communities come together, we create opportunities to build more responsive and accountable health system. This Baraza provides an important platform for honest dialogue and collective problem solving. I encourage participants to examine evidence, share experiences from across the region, and develop practical recommendations that strengthen legal and policy frameworks for sexual and reproductive health and rights across the life course. As Zimbabwe, we remain committed to working with all stakeholders to ensure our health system evolves to meet the needs of our people. Together we can build systems that protect dignity, promote equity, and guarantee access to quality health care regardless of age, gender, disability, or place of residence. As we begin our deliberations, let us be guided a shared commitment to ensure that no child is denied no young person is excluded from essential health services. No adult faces preventable barriers to care. No older person is forgotten simply because of age. Let us use this Baraza to strengthen the partnership between health and the law and to advance practical solutions that improve the lives of people across Zimbabwe and the entire African continent. I thank the organizers, our development partners, and every participant for your commitment to advancing reproductive justice. It is now my singular honor and privilege to officially declare the 4th Annual Reproductive Justice Litigation Baraza open. I thank you.
Thank you very much, Honorable Minister. I'd like to take the opportunity to introduce to you our keynote speaker, who is going to come and join us here to give us the keynote speech. The keynote speaker is somebody that many people admire and wish that one day they'll meet physically. We are with her here today. I'll take the opportunity to introduce Dr. Taleng Mofokeng, a medical doctor who has worked for 18 years in the global health sector as an expert and a decoloniality scholar working on reproductive health and rights. He specialized in sexual and reproductive health and rights, public health policy and governance, bodily autonomy, and health justice. She's a United Nations Special Rapporteur on the rights of everyone to the highest attainable standard of physical and mental health. She's an adjunct associate professor at the University of Cape Town and a senior scholar of Georgetown University, Center for Global Health Policy and Politics. Dr. Taleng is a former commissioner at the Commission for Gender Equality. She has worked extensively in an intersectional analysis and made jurisprudential and normative contributions to law and policy and public health discourse on reproductive autonomy, self-apportion, sexual health, gender justice, and the structural determinants of health through clinical and health system setting. She's also intervened as amicus curiae in many jurisdictions across the world. She has briefed the US. She has briefed the US and spoke before the Senate on the Global Gag Rule, delivered the first civil society statement on safe and legal abortion at the United Nations Human Rights Council, and provided technical expertise briefing to judicial and legislative committee members around the world, including the European Parliament, members of the East African Legislative Assembly, EALA, and civil society organizations. Her scholarly work is very broad and is wide, and she's widely published globally. And as our keynote speaker, Dr. Taleng is coming here to the 4th Reproductive Justice Litigation Baraza to bring her groundedness and her Africanness, her African-led and global perspective to the Baraza's focus on age as a determinant of SRHR and the role of law, health systems, and courts in protecting bodily autonomy, dignity, and safety across the world. Who other than Dr. Taleng should have been the best person to give us a keynote? Please bring your hands together to welcome Dr. Taleng.
morning, everyone. Good morning. Thank you so much for having me as your keynote speaker for such an important gathering. And I want to just already say that I stand on the protocol that has been established and want to, of course, say thank you very much to the organizers for pulling this incredible convening. Colleagues, comrades, advocates, especially young people, and friends of justice in this room, I come to this podium this morning as a doctor. Before I come to it as a special rapporteur of the United Nations, I'm a black woman from South Africa who grew up in a Bantustan area called Qwaqwa, which was a racially segregated space in the apartheid regime in South Africa. And so I stand here as a woman, as a person, as a child, who embodied many of the characteristics that lead to discrimination, stigmatization, and often even criminalization. I have lived under apartheid, and I still live with this inheritance, the crushing weight of inequality, and a democracy that promised everything that has delivered unevenly so and too slowly. And in my Johannesburg practice, in my medical clinic, I held the hands of many patients, many young people who arrived simply too late, or not at all, some of them, because of systems that are built in the name of protecting them. But in truth, those systems were made to abandon them. And so across the 6 years of my mandate as the UN Special Rapporteur on the right of everyone to the highest attainable standard of physical and mental health, a mandate given to me by the United Nations Human Rights Council to examine the right to health, but more importantly, the reasons why, for many people around the world, the right to health has simply not been realized, and especially understanding that obstacles related to sexual and reproductive health are interrelated and intertwined and exist both at the level of clinical care, health systems, and underlying determinants of health. I have sat across adolescents as patients treated by the law as simultaneously too young to consent to the care they needed and old enough, however, to be married off, to give birth, to be criminalized. And I sat too with the complaints of older women whose sexuality and reproductive health simply disappeared from the law's vocabulary, from clinical care, once they cross a different unspoken threshold. And we know that with the politics of the body, once a woman is no longer in her fertility period, she is seen and deemed undesirable in many ways. And that contradiction, the law drawing its firmest lines exactly where the body needs its most flexible protection. It is not a footnote to reproductive justice. It is a design flaw that this Baraza exists to correct. A few weeks ago, literally just a few weeks ago, I closed my final report to the Human Rights Council as a special rapporteur as my tenure has come to an end. I presented a report titled The Right to Health as an Enabler of Dignity. And it's exactly on this note that dignity is not something that the law grants or can prescribe only at birth. It is something the law owes every single person at every single stage of life. And that's what I want to speak about today. Age is not a neutral demographic variable, nor a clinical footnote, but age is a determinant of health, a site of power often contested between state and non-state actors, and a mechanism through which states decide who is considered fully human and who must wait. In 2016, on January the 20th, the Constitutional Court of this country decided something this Baraza should treat as foundational. Loveness Mutsuru and Ruvimbo Tsopotsi, married off as young girls, mothers before they were adults, in the eyes of every other law that governed them. It asked the court to strike down the provision of the Marriage Act that let a girl of 16 be married off with ministerial consent, with a boy had to wait until 18. The court did not treat this as a technicality. And reading the Constitution together with the Convention on the Rights of the Child, the African Charter on the Rights and Welfare of the Child, and of course CEDAW, it held that 18 is the age of marriage for every child in Zimbabwe, full stop, regardless of sex. That judgment is final, it is binding, and is the clearest proof this continent has produced that a single rigid age threshold set honestly can be the remedy rather than the harm, provided the law finally asks what it should have asked all along. What does this specific child need protected, and from whom? Muturu is the doctrine. This Baraza concept notes it at face. Ngozi, 16, in Kano, already a mother of two, already the component of head of her household in every respect, except the one that the law insists on controlling, her own body. Ngozi is not an illustration invented for sympathy. She is precise description of the same legal contradiction Muturu corrected in Zimbabwe and that most of the continent has not yet corrected elsewhere. The law that will not protect her from poverty, from the marriage that made her a mother at 14, or from the grief of losing her father, finds its firmest resolve exactly at the boundary of her body, telling her that she must be 18 to decide what happens to her body, to fully have autonomy. A law that is flexible about everything except a girl's right to make decisions about her body, over herself, and has not misjudged her capacity. It has misdirected its protection. We speak of human rights, we affirm them, treaty after treaty, that all persons are entitled to have their rights protected. We rarely pause on the first word, human. Adolescents are still fighting for it. They are still fighting to be recognized, not as subjects of protection by state and non-state actors, but as subjects of rights, still fighting to have their knowledge of their own bodies taken seriously by the systems that govern them. Age is a determinant across the life course. An elderly widow whose sexuality is met with cultural sanction and institutional neglect stands on the same fault line as a 16-year-old denied contraception or safe abortion care, or simply just information about her own sexual pleasure. Both have had a single rigid marker, too young, too old, and substituted for an honest assessment of who they are and what they need. And I will return to both ends of that life course before I close. It is important to look beyond what the numbers on a global perspective provide us. It is often the inequality within countries that's equally as important as the inequality between countries. Zimbabwe's own numbers make this point. An adolescent birth rate of 93 per 1,000 women aged 15 to 19, more than double the global average, with real but fragile progress down from 108 in 2019. And across the wider region, UNICEF data shows that 130 million African women and girls are married before their 18th birthday. This is the highest regional obstacle, burden, strain anywhere in the world, with 9 of the 10 highest child marriage rates on earth are happening on this continent. These numbers are not an argument for a stricter wall at 18. They're an argument that a wall drawn at a single birthday has failed for decades to protect the very girls we claim to care about and to protect, while simultaneously being used to deny adolescents contraception, information, abortion care, post-abortion care, and basic information about their own bodies. A legal instrument that fails at protection and succeeds at exclusion is not a protective instrument. It is a sorting instrument, and this Baraza's task is to say, in pleading plainly, behind the failure sits a premise I want this room to reject. And this premise is that age is an inhibitor. Age is a single number that flips a person from incapable to capable, from voicelessness to entitled simply overnight. This premise is not protective. It is a colonial import that many African states who claim to be in the post-colonial era continue to perpetuate. And it does not describe how African society actually organized age before it was imposed on them. Now, Sylvia Tamale's work is precise on this very point. In Decolonization and Afrofeminism, she argues that liberal paradigms' obsessions with the isolated rights-bearing individual is itself a foreign grammar, and that Ubuntu, the relational African conception of personhood, offers a more accurate account of how African societies distributed obligation, protection, and very importantly, voice. Age, on this account, was never a wall. It is organized who taught whom and who was owed what protection, but it did not by itself determine incapacity or capacity. A child belonged not only to parents, but to a whole community. We know the saying, it takes a village to raise a child. And that distributed belonging generated the obligation to bring young people into knowledge and decision-making, rather than exclude them from it. I'm not romanticizing a pre-colonial ideal of what Africa is, could be. No society has ever organized age with perfect justice or precision. And the claim is narrower. The capacity-based model, international law, is now rebuilding under the name evolving capacities. And it's not a foreign gift to Africa. It is a return to grammar colonial suppressed. International law already gives us that alternative grammar if we would use it. For example, Article 12 on the Convention on the Rights of the Child requires that the views of the child be given due weight in accordance with their age and maturity. General Comment number 20, which the Committee on the Rights of the Child dedicated to adolescents, is explicit. Adolescents are rights holders now, not future rights holders, and not rights holders in waiting. And I often say when I speak to young people that they are leaders already of their own lives. They are not a perpetual future to be harnessed into leadership. And so what we see in practice instead of a labyrinth, one age for consenting for medical treatment, another for consenting to sexual interaction, another still for accessing a specific reproductive health service. A maze no adolescent can navigate without an adult intermediary who may not be safe, who may not be willing, and is never required for an adult patient. That is not protection. It is infantilization of adolescents wearing the costume of care. Often you will hear African values, African culture does not allow for certain things. The question is whose sovereignty, whose culture? And this Baraza's program names the maneuver now being attempted across our legislatures and continental institutions. The age thresholds that shut adolescents out of contraception and comprehensive sexuality education are not an African custom reasserting itself. There are colonial penal codes, British and Portuguese in origin, never renegotiated at independence, now defended in the language of African cultural authenticity by instruments like the draft African Charter on the Protection of the Family. sovereignty, and religious and cultural values, the FSV Charter. Whose values, which Africa, and whose family? I want to be precise about that particular instrument because precision matters when the subject is something that will cost lives, which is already costing lives. It did not begin in Africa. It began in Utah in the US in 2022, where Sharon Slater of Family Watch International, a US organization the Southern Poverty Law Center designates as a hate group, closely tied to the authors of Project 2025. They convened African lawmakers around a family values agenda before relocating the enterprise to Uganda for 3 successive interparliamentary conferences between 2023 and 2025. Another Dutch organization, Christian Council International, has publicly claimed credit for drafting the text itself. And in June this year, just weeks before this Baraza convened, the 4th conference was held inside Ghana's own parliament. Welcome to the red carpet and the entire state security and the pomp and ceremony usually reserved for heads of state. 18 of the 20 lawmakers present voted to advance this charter. Only South Africa and Mozambique abstained. We have to talk about precision. And we must be precise about what this charter proposes because precision matters here as well. This calls on states to define away any right to abortion with no exceptions, not for a woman whose life is at risk, not for a child who is the victim of rape or incest, not for anyone under any circumstance. And recent data shows that 38 African countries found that nearly 2/3 of its citizens actually believe abortion is justified when a woman's health is at risk. And the charter does not speak for African people. It actually speaks against them. It exports certain ideas and values and propaganda and wants to firmly implant them on the African continent. It calls for eliminating comprehensive sexuality education on the unevidenced claim that it sexualizes children. And against 3 decades of research showing the opposite, it defines family as existing only between a man and a woman, erasing the diverse, multi-generational, including same-sex families that have always existed on the continent. Some of us are women leaders in the world, but it also takes blended families to be able to raise our own children as we go around the world doing the work of human rights. And under these people's ideas, even those families do not count. References the HPV vaccine, which protects against cancer that kills hundreds of thousands of African women every single year, cervical cancer. There are no alternatives to human rights, and we must reject these premises that seek not only just to divide us, but cause considerable, measurable harm just in its ideation before they are even adopted or even implemented. Outside that, a parliament in Accra, a coalition marched under the banner "Refusing Harm in Our Name," carrying a message worth repeating from this platform, that African family has always made room. The Africa we live in has always held more people than any single definition of family can contain. Our work is to be defined that expansiveness, not to shrink it. And our work has a deadline. The SFB Charter's architects are aiming for this adoption, this very harmful text at the African Union Summit in February of 2027, which is simply 18 months from now. It's a short time, but it's enough time to galvanize and to advocate and to organize. And with the next interparliamentary conference already scheduled for Burkina Faso, the drafters have a calendar. This Baraza must certainly have one too. Afia Nahaki's recent publication in the Health and Human Rights Journal on post-abortion care, named a frame slippage, the collapse of a clinical spectrum of pregnancy-related care into a single criminal binary, policed as though that binary were natural rather than constructed. It's very important for us to assume as a default setting an integration of what we are inheriting as law, but what we are imagining together for a prosperous Africa. And I want to borrow that insight and name its sibling, chronological slippage, the collapse of a developmental spectrum of capacity, of voice, and this need into a single binary, child versus adult, pinned to one birthday, enforcing it as though it were a fact of nature rather than a colonial administrative convenience. They didn't even care to give our parents the actual correct birth dates in any case. The same collapsing move happens whenever mental capacity rather than age forecloses a decision instead of informing it. I did open earlier on with referencing Mutsuru because it is the case the whole continent came to know. And this city decided it, finally, and bindingly so, a decade ago. This city is writing the next chapter as we sit here, 2 High Court rulings still awaiting Constitutional Court confirmation. WSA and another versus Minister of Health and Childcare, and Community Working Group on Health and Batisa versus Minister of Health. This is extending access to safe abortion for adolescents and survivors and confronting the same rigid capacity thinking where it operates on mental illness rather than age. The shape is the same. It's a rigid, unexamined capacity marker, a birthday in one matter, a diagnosis in another, asked to do the work that an honest, individualized assessment of need should be done instead. This is not a matter that is just peculiar to Zimbabwe. Kenya, Malawi, Zambia, and Nigeria are producing the same jurisprudence from different angles. This Baraza exists to connect what each is discovering separately, chronological slippage and capacity spillage more broadly, in one continental mechanism, and it yields to one continental argument. As an activist, as a feminist, there is always a call to action, a march to order, a mandate that is often given. And for this room, it is very important to have a decolonial reading of these problems that we are confronting. It's not a supplement to reproductive justice work added at the end of a sound complete. It is a fundamental reorientation of how we understand the problem and therefore what we think the solutions are that we can reach collectively. There are 4 charges and calls to action that I want to leave you with. To litigate age-based restrictions as discrimination. We know in terms of principles of human rights, one cannot discriminate based on age. And the Maputo Protocol's Article 14 guarantees women's rights to health, including sexual and reproductive health. The African Charter on the Right and Welfare of the Child guarantees the rights of children across this continent. And we must build litigation strategies that name age-based exclusion as discrimination. And under these instruments, under domestic constitutions, and under the evolving capacity standard that the CRC committee has already articulated, we must find courage and action. The jurisprudence Zimbabwe is writing right now, provisionally in 2 rulings awaiting confirmation, is exactly the kind of argument that is ours to extend. 2, we must produce African model legislative frameworks. We need harmonized, rights-consistent, age of consent provisions grounded in evolving capacities, and they must be African-generated, not imported templates that reproduce the power asymmetries we are trying to dismantle. The scholarship, the clinical experience, and the lived experiences are needed to rewrite and write them exist in this very room. 3, we must hold the gaze of the Kampala Charter and resist the FSV Charter. The Kampala Charter on Decriminalizing Sexual and Reproductive Health and Rights in Africa. They were adopted at the 3rd Baraza a year ago. They represent a genuine and hard-won continental consensus. The FSV Charter, advancing through African Union corridors in the darkness towards the 2027 AU Summit, is antithesis. Both cannot prevail. Only human rights can prevail. And we need accountability mechanisms that track Kampala's commitments and coordinated evidence-based campaign and advocacy efforts against the FSV Charter in national parliaments and at the African Commission and at every AU institution that we have. And that starts in this room. The flame that needs to burn going forward will be lit in this room. And 4, we must document with rigor, with love, centering dignity. The lived experience of adolescents denied, criminalized, or shamed by systems that claim to protect them must be recorded, analyzed, and elevated with full ethical rigor and genuine respect for the peoples sharing their story. Dignity as a central theme to human rights is very important because nobody can prescribe for you what a dignified life is. And so we ought to listen, not just to this testimony, but to listen to it as credible evidence. Their voices carry an authority no position paper can replicate, and they are belonging in our pleadings. In closing, I just want to focus and return back to the elderly widow. And research has documented the stigma surrounding elderly persons' sexuality and has named older persons' sexual and reproductive health a policy blind spot. Claudia Marla's own report on older women presented while she was the independent expert mandate holder for the rights of older persons in Geneva. She titled Aging and Gender Compound each other in ways the human rights system has barely begun to measure. CEDAW itself has flagged the silence. The same chronological slippage that treats 16 as too young treats 60 as too old to need sexual and reproductive health, counseling, screening, STI treatment, and protection from sexual violence. And so a rights framework organized entirely around the productive years is not a life course framework. It is a fertility framework wearing a rights-based model that again seeks to instrumentalize the bodies of women and girls. The gap now has an instrument of its own. The protocol to the African Charter on Human and People's Rights on the rights of older persons in Africa exists precisely because Article 18.4 of the African Charter left older persons' protections undefined, and the mandate on the right of the older person has spent recent years building the evidence and the record on the exact mechanism this Baraza names, which is a diagnosis or an assumption about old age, substituted for an honest assessment of what a woman can decide and wants to decide for herself. That record is there to be cited, the same way Mutsuru cited the Convention on the Rights of the Child. Litigators arguing chronological slippage for a girl of 16 and litigators arguing capacity slippage for a woman of 60 are making the same argument. They should be reading each other's briefs for a truly intersectional, reproductive justice-based argument. Ngozi is 16. The widow is 60 or 70 or older still. Between them sits every age this profession has quietly decided it's either too young or too old to be trusted with decisions over its own body. And I'm not asking you to resolve that in 3 days. I am asking you, however, to leave this Baraza with a habit you did not fully have when you arrived perhaps this morning. Naming chronological slippage and its sibling capacity slippage. Every time you see a birthday or a diagnosis during the work that an honest individual assessment of need and voice should be doing instead. And to the young people in this room, and some of us who are maybe not so young anymore, but we still have the energy of youth, and to those who will read these words, your right to health is not aspirational. It is not a future entitlement to be unlocked when society sees and decides you are sufficiently mature or well-behaved enough as a reward. It is not conditional on adult approval or a provider's comfort. It exists in your body, at your age, in this very moment, and we must refuse any reading of our covenants that treat it otherwise. You are African with integrity, who deserves bodily autonomy and to be treated with integrity. African values allows, again, for an expansive nature of being. First, with the person who you are, but also how you relate to the world. Zimbabwe has already shown this argument can win outright in Muzulu, and is showing it again provisionally in the two rulings now awaiting the Constitutional Court's judgment. We must take these arguments home with us to show that in fact Africa is more united and understands human rights far more than our opponents want us to believe. Whichever way that the court decides, the briefs, the arguments, the human rights-based and evidence-based arguments are key on how we mobilized to defend human rights in this continent. The architecture of exclusion is simply too old, too archaic, it has expired. There is no place for that. It was written by human hands, and it can be unmade by these very human hands. And the right to health is not a negotiable right. It is interrelated, it is intertwined, and it's interdependent on many other human rights. It does not diminish with youth. It does not diminish with age. It does not wait for political will to catch up. It does not ask for permission. It simply is. And in closing, I want to say thank you to all of you for being here today, and hope that we are inspired in a different way to collaborate and network as we move forward to push back against the pushback, but also do the important work of setting our own agenda. As human rights practitioners, we also cannot be always just responding in defense. We have to lead the narrative and set the stage for our own agenda. With that, I would like to say thank you very much.
Wow, 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 wow. What a powerful keynote. I will not even dare to say anything because we have a whole panel of distinguished guests and delegates that are going to respond to that keynote. I'd like to announce a slight change in the program. We are now going to break off for a tea break, but before the tea break, we'll have a group picture because just like the keynote speaker said, we must document our journeys and we must redefine the narratives. We'll have the tea break for 30 minutes and then come back here after 30 minutes and resume with the program the way it is on the program. We are going to go outside there to take some sun, but even also take the group picture and then get back. Yes, they told us Zimbabwe is warm. That's what Maria told us. Welcome to the warmth of Zimbabwe. Yes, join me to feel the warmth. It's a state of mind. So let's go and take the tea break, and then the picture first, and then the tea break. See you in 30 minutes. We'll have the group picture inside here. Let's have the picture inside. Apologies. Let's move for the group picture. It's going to happen inside. The group picture. Let's have the group picture, please. Thank you too. Let's take the group picture, please. Come to the podium. Go to the podium for the group picture. Go to the podium. Can we get to the podium and organize ourselves? Organize yourselves at the podium. Organize yourselves at the podium. Okay, we can fit in this picture. Make sure your face is seen. Make sure you are seen. Make sure your face is seen. I don't know whether people will fit. Aren't you taking the picture? Maybe some people should sit in front.
Put some seats. Put some seats.
Maybe some chairs.
Where is it?
We can get some chairs. You go people and sit in front. Go and sit in front. You can go and sit in front. Thank you. Let's go and have our tea break and continue the networking. Continue networking over tea.
It's important to have a deep understanding on litigation reproductive justice.
Do we appreciate that what affects a woman out there affects all of us? What affects one of us affects all of us.
And after here, we hope that you're going to change and shape the narrative around reproductive justice on the continent, but also beyond the continent.
Please, let's go out there and let's make disciples.
I'd like to welcome you to our inaugural media fellowship in collaboration with Reyes and the African Institute for Investigative Journalism under the theme Navigating and Mitigating the Impact of Complex Global Policies like a Global Gag Rule.
This training is not just the fellowship. It's a journey that we are going to walk together, and this is just the beginning of it.
This meeting is really going to help us to find a middle ground. What does it mean really to cover aspects of sexual reproductive health and rights, and most importantly, in courtrooms?
Do stories on abortion, post-abortion care, and family planning. Create rapport with organizations that deal with these matters.
Health systems in Africa have been relying a lot on foreign aid. Human rights generally have been under attack for a while now.
Whatever angle you look at it, and from wherever we come from, the perceptions that have been put out, the tags that have been put around SRHR, it all comes down to the woman.
And that explains just the skepticism to come forward and speak to the media about things like abortion.
It is important to have a deep understanding on litigation reproductive justice.
Do we appreciate that what affects a woman out there affects all of us? What affects one of us affects all of us.
And after here, we hope that you're going to change and shape the narrative around reproductive justice on the continent, but also beyond the continent.
Please, let's go out there and let's make disciples.
I'd like to welcome you to our inaugural media fellowship in collaboration with Reyes and the African Institute for Investigative Journalism under the theme Navigating and Mitigating the Impact of Complex Global Policies like a Global Gag Rule.
This training is not just the fellowship. It's a journey that we are going to walk together, and this is just the beginning of it.
This meeting is really going to help us to find a middle ground. What does it mean really to cover aspects of sexual reproductive health and rights, and most importantly, in courtrooms?
Do stories on abortion, post-abortion care, and family planning. Create rapport with organizations that deal with these matters.
Health systems in Africa have been relying a lot on foreign aid. Human rights generally have been under attack for a while now.
Whatever angle you look at it, and from wherever we come from, the perceptions that have been put out, the tags that have been put around SRHR, it all comes down to the woman.
And that explains just the skepticism to come forward and speak to the media about things like abortion.
It is important to have a deep understanding on litigation reproductive justice.
Do we appreciate that what affects a woman out there affects all of us? What affects one of us affects all of us.
And after here, we hope that you're going to change and shape the narrative around reproductive justice on the continent, but also beyond the continent.
Please, let's go out there and let's make disciples.
I'd like to welcome you to our inaugural media fellowship in collaboration with RAIES and the African Institute for Investigative Journalism under the theme Navigating and Mitigating the Impact of Complex Global Policies like a Global Gag Rule.
This training is not just the fellowship. It's a journey that we are going to walk together, and this is just the beginning of it.
This meeting is really going to help us to find a middle ground. What does it mean really to cover aspects of sexual reproductive health and rights, and most importantly, in courtrooms?
Do stories on abortion, post-abortion care, and family planning. Create rapport with organizations that deal with these matters.
Health systems in Africa have been relying a lot on foreign aid. Human rights generally have been under attack for a while now.
Whatever angle you look at it, and from wherever we come from, the perceptions that have been put out, the tags that have been put around SRHR, it all comes down to the woman.
And that explains just the skepticism to come forward and speak to the media about things like abortion.
It is important to have a deep understanding on litigation reproductive justice.
Do we appreciate that what affects a woman out there affects all of us? What affects one of us affects all of us.
And after here, we hope that you're going to change and shape the narrative around reproductive justice on the continent, but also beyond the continent.
Please, let's go out there and let's make disciples.
I'd like to welcome you to our inaugural media fellowship in collaboration with RAIES and the African Institute for Investigative Journalism under the theme Navigating and Mitigating the Impact of Complex Global Policies like a Global Gag Rule.
This training is not just the fellowship. It's a journey that we are going to walk together, and this is just the beginning of it.
This meeting is really going to help us to find a middle ground. What does it mean really to cover aspects of sexual reproductive health and rights, and most importantly, in courtrooms?
Do stories on abortion, post-abortion care, and family planning. Create rapport with organizations that deal with these matters.
Health systems in Africa have been relying a lot on foreign aid. Human rights generally have been under attack for a while now.
Whatever angle you look at it, and from wherever we come from, the perceptions that have been put out, the tags that have been put around SRHR, it all comes down to the woman.
And that explains just the skepticism to come forward and speak to the media about things like abortion.
It is important to have a deep understanding on litigation reproductive justice.
Do we appreciate that what affects a woman out there affects all of us? What affects one of us affects all of us.
And after here, we hope that we are going to change and shape the narrative around reproductive justice on the continent, but also beyond.
A long time ago, before you and I were born, our forefathers and mothers had full custody of a priceless gift.
A gift that gave ceaselessly, a lifeline that linked generations endlessly, a gem that was shamelessly stepped on.
Abakurambire, our forefathers and mothers, they understood. They understood the value and context of this, our sexuality complex. To them, it was more than just intercourse.
It was a source and a resource of continuity and multiplication. One without a replica, of course, a treasure of invaluable pleasure, devalued by foreign values. To our forefathers and mothers, Eriba Jajafe, sexuality was a place of pride and purity that shaped the community, a place where identity made love to responsibility and gave birth to hope.
A hope that now hangs on the ropes of the foreign man on top. Kwamababu wetu, to our forefathers and mothers, reproductive justice was the key.
The spiritual key that unlocked possibilities for the society until it got locked up by ubukila, slavery.
To our forefathers and mothers, sexuality was poetry, a metaphor of succession,
a representation of the interconnecting political, social, and economic fabrics. Sexuality existed above the confines of the white man's metrics.
Our forefathers and mothers,
Okoko, listened to the whispers of equity and agency, the whispers of reproductive justice and mediation, the whispers that were wisely woven into socialization until they were muffled by the noise of colonization, a distortion that still rattles the African civilization. To our forefathers and mothers, the fabric of being was like water, freely following the flow of function with a clear introspection of home. A home where stigma had no seat at the table, a community where masculinity and femininity danced in the kitchen of necessity and in the hunting ground for survival.
Their purity of mind was unrivaled. They were the Venda of South Africa,
the Nandi of Kenya,
the Kuria of Tanzania,
the Bara of Madagascar, until they tasted the tears of Okonko,
and things fell apart as gushing white waters formed a river between them and their identity,
between us and our identity. Now look at us. See, a society drowning in a sea of delusion, lungs submerged by waters of confusion, drowning. Our sexuality is drowning because we have lost touch of our ancestral grounding. Look at us. See a sea of confusion, a sea of delusion, of floating spirits in bodies we no longer own, chanting creeds of autonomy, recycling and reusing narratives that continue to reduce our own ideologies. Look at us. See, laba, leba, bona, tazama.
Look at gender. Before that, throw away your foreign lenses.
There's a lot to unlearn before we come to our senses. See, or rather, unsee. Unsee the notion that there is sin in your sexuality. Abandon that narrative because it is not our own.
Let us weave our own paths of reproductive justice, with threads of gender, race, and class intertwining, with diversities converging at the threshold of an African identity.
Let us mold our own methods of mediation, form our own fields of assimilation, and put a stop to this disease that is discrimination.
Let us rise up with voices united and strong in the fight for justice where all belong. For the path to liberation is not singular, it's as complex and diverse as our ancestral root system.
Let us follow the teachings of our roots. Roots like Mulondo that instruct the male anatomy. Forget Victorias and remember the secrets of the acacia tree that instructs us to honor our bodies.
Let us reclaim our reproductive justice, an Afrocentric approach of breaking chains, celebrating the resistance that flows in our veins.
Together, we advocate, educate and inspire, building communities that stand strong and aspire. In the litigation of justice, we find our voice, reimagining a future where Africa can rejoice.
A long time ago, before you and I were born, our forefathers and mothers had full custody of a priceless gift.
A gift that gave ceaselessly, a lifeline that linked generations endlessly, a gem that was shamelessly stepped on.
Our kurambire, our forefathers and mothers, they understood. They understood the value and context of this, our sexuality complex. To them, it was more than just intercourse.
It was a source and a resource of continuity and multiplication. One without a replica, of course, a treasure of invaluable pleasure, devalued by foreign values. To our forefathers and mothers, Eriba Jajafe, sexuality was a place of pride and purity that shaped the community, a place where identity made love to responsibility and gave birth to hope.
A hope that now hangs on the ropes of the foreign man on top. Kwamababu wetu, to our forefathers and mothers, reproductive justice was the key.
The spiritual key that unlocked possibilities for the society until it got locked up by ubukila, slavery.
To our forefathers and mothers, sexuality was poetry, a metaphor of succession,
a representation of the interconnecting political, social, and economic fabrics. Sexuality existed above the confines of the white man's metrics.
Our forefathers and mothers,
Okoko, listened to the whispers of equity and agency, the whispers of reproductive justice and mediation, the whispers that were wisely woven into socialization until they were muffled by the noise of colonization, a distortion that still rattles the African civilization. To our forefathers and mothers, the fabric of being was like water, freely following the flow of function with a clear introspection of home. A home where stigma had no seat at the table, a community where masculinity and femininity danced in the kitchen of necessity and in the hunting ground for survival.
Their purity of mind was unrivaled. They were the Venda of South Africa,
the Nandi of Kenya,
the Kuria of Tanzania,
the Bara of Madagascar, until they tasted the tears of Okonko,
and things fell apart as gushing white waters formed a river between them and their identity,
between us and our identity. Now look at us. See, a society drowning in a sea of delusion, lungs submerged by waters of confusion, drowning. Our sexuality is drowning because we have lost touch of our ancestral grounding. Look at us. See a sea of confusion, a sea of delusion, of floating spirits in bodies we no longer own, chanting creeds of autonomy, recycling and reusing narratives that continue to reduce our own ideologies. Look at us. See, laba, leba, bona, tazama.
Look at gender. Before that, throw away your foreign lenses.
There's a lot to unlearn before we come to our senses. See, or rather, unsee. Unsee the notion that there is sin in your sexuality. Abandon that narrative because it is not our own.
Let us weave our own paths of reproductive justice, with threads of gender, race, and class intertwining, with diversities converging at the threshold of an African identity.
Let us mold our own methods of mediation, form our own fields of assimilation, and put a stop to this disease that is discrimination.
Let us rise up with voices united and strong in the fight for justice where all belong. For the path to liberation is not singular. It's as complex and diverse as our ancestral root system.
Let us follow the teachings of our roots. Roots like Mulondo that instruct the male anatomy. Forget Victorias and remember the secrets of the acacia tree that instructs us to honor our bodies.
Let us reclaim our reproductive justice, an Afrocentric approach of breaking chains, celebrating the resistance that flows in our veins.
Together, we advocate, educate, and inspire, building communities that stand strong and aspire. In the litigation of justice, we find our voice, reimagining a future where Africa can rejoice.
A long time ago, before you and I were born, our forefathers and mothers had full custody of a priceless gift.
A gift that gave ceaselessly, a lifeline that linked generations endlessly, a gem that was shamelessly stepped on.
Our kurambire, our forefathers and mothers, they understood. They understood the value and context of this, our sexuality complex. To them, it was more than just intercourse.
It was a source and a resource of continuity and multiplication. One without a replica, of course, a treasure of invaluable pleasure, devalued by foreign values. To our forefathers and mothers, Eriba Jajafe, sexuality was a place of pride and purity that shaped the community, a place where identity made love to responsibility and gave birth to hope.
A hope that now hangs on the ropes of the foreign man on top. Kwamababu wetu, to our forefathers and mothers, reproductive justice was the key.
The spiritual key that unlocked possibilities for the society until it got locked up by ubukila, slavery.
To our forefathers and mothers, sexuality was poetry, a metaphor of succession,
a representation of the interconnecting political, social, and economic fabrics. Sexuality existed above the confines of the white man's metrics.
Our forefathers and mothers,
Okoko, listened to the whispers of equity and agency, the whispers of reproductive justice and mediation, the whispers that were wisely woven into socialization until they were muffled by the noise of colonization, a distortion that still rattles the African civilization. To our forefathers and mothers, the fabric of being was like water, freely following the flow of function with a clear introspection of home. A home where stigma had no seat at the table, a community where masculinity and femininity danced in the kitchen of necessity and in the hunting ground for survival.
Their purity of mind was unrivaled. They were the Venda of South Africa,
the Nandi of Kenya,
the Kuria of Tanzania,
the Bara of Madagascar, until they tasted the tears of Okonko.
And things fell apart as gushing white waters formed a river between them and their identity,
between us and our identity. Now look at us. See, a society drowning in a sea of delusion, lungs submerged by waters of confusion, drowning. Our sexuality is drowning because we have lost touch of our ancestral grounding. Look at us. See a sea of confusion, a sea of delusion, of floating spirits in bodies we no longer own. chanting creeds of autonomy, recycling and reusing narratives that continue to reduce our own ideologies. Look at us. See, laba, leba, bona, tazama.
Look at gender. Before that, throw away your foreign lenses.
There's a lot to unlearn before we come to our senses. See, or rather, unsee. Unsee the notion that there is sin in your sexuality. Abandon that narrative because it is not our own.
Let us weave our own paths of reproductive justice, with threads of gender, race, and class intertwining, with diversities converging at the threshold of an African identity.
Let us mold our own methods of mediation, form our own fields of assimilation, and put a stop to this disease that is discrimination.
Let us rise up with voices united and strong in the fight for justice where all belong. For the path to liberation is not singular. It's as complex and diverse as our ancestral root system.
Let us follow the teachings of our roots. Roots like Mulondo that instruct the male anatomy. Forget Victorias and remember the secrets of the acacia tree that instructs us to honor our bodies.
Let us reclaim our reproductive justice, an Afrocentric approach of breaking chains, celebrating the resistance that flows in our veins.
Together, we advocate, educate and inspire, building communities that stand strong and aspire. In the litigation of justice, we find our voice, reimagining a future where Africa can rejoice.
Behind prison walls in Senegal, a quiet crisis is unfolding.
It was total hell.
Cells built for thieves and traffickers now hold mothers, daughters, students, women inside crowded prisons. From those who have served in prison to the lawyers on the front line in courtrooms and inside clinics where doctors walk a razor's edge between care and criminal liability.
It's all this religiosity that's killing our children. In the name of God, our girls are dying.
This is not just a story about abortion. It is a story about incarceration, about poverty and power.
These judges are deliberately refusing to take on these cases.
Who decides what justice looks like? The tales of Senegal's unsafe abortions premieres in March on Ahaki's digital pages. Behind prison walls in Senegal, a quiet crisis is unfolding.
It was total hell.
Cells built for thieves and traffickers now hold mothers, daughters, students, women accused of ending.
Are you seeking advanced qualifications in sexual and reproductive health? Look no further than Ahaki Institute, a licensed higher learning institution. Our programs are designed to equip you with the essential knowledge and practical skills to qualifications in sexual and reproductive health. Look no further than Ahaki Institute, a licensed higher learning institution. Our programs are designed to equip you with the essential knowledge and practical skills to tackle pressing health challenges, influence policy, and advance reproductive justice. With a flexible learning structure of 70% virtual and 30% in-person sessions. All courses are fully accredited by the National Council for Higher Education. For more information, visit www.ahakiinstitute.ac or call WhatsApp 0744 616 801 or 0773 016 853. Ahaki Institute, nurturing multidisciplinary professionals. Are you seeking advanced qualifications in sexual and reproductive health? Look no further than Ahaki Institute, a licensed higher learning institution. Our programs are designed to equip you with the essential knowledge and practical skills to tackle pressing health challenges, influence policy, and advance reproductive justice. With a flexible learning structure of 70% virtual and 30% in-person sessions, all courses are fully accredited by the National Council for Higher Education. For more information, visit www.ahakiinstitute.ac or call WhatsApp 0744 616 801 or 0773 016 853. Ahaki Institute, nurturing multidisciplinary professionals. Are you seeking advanced qualifications in sexual and reproductive health? Look no further than Ahaki Institute, a licensed higher learning institution. Our programs are designed to equip you with the essential knowledge and practical skills to tackle pressing health challenges, influence policy, and advance reproductive justice. With a flexible learning structure of 70% virtual and 30% in-person sessions, all courses are fully accredited by the National Council for Higher Education. For more information, visit www.ahakiinstitute.ac or call WhatsApp 0744 616 801 or 0773.
Ladies and gentlemen, we are running behind time. Can we take our seats? Welcome back and thank you so much. And as we continue with our discussions, we are going to have a testimony and a story from a victim of child marriage. And she has been generous enough to share her personal story with us. And she's with us in the room. And as she gives us her story, I plead with you, the delegates in the room, that we understand and we don't blame or try to shame, but take this as a lesson so that when we go back to our communities, when we go back to our organizations, we know and will have had a life experience and a lived reality from a survivor of child marriage. Ladies and gentlemen, allow me to welcome Chantel Tayendesa. She is now 21 years, but she got married at the age of 15. She resides in Marange, and she has two children. She's a survivor, as I said, and she's also part of the AIDS Healthcare and Foundation AFH Child Girls Act cohort. Ladies and gentlemen, help me welcome Chantel. Let's put our hands together and welcome Chantel. And she's going to speak in Shona, and to help her with the interpretation, Ms. Matrai will assist. Thank you. Chantel, you can have the floor.
Okay, pamusoro vanhu vese vanoremekedzwa vari munhu ini ndoitwa Chantel Tayendesa from Bocha Marange. Ndakarorwa ndine 15 years. Murume anga akandiroora anga ine 37 years.
Chantel, thanks. Good morning, everyone. All protocols observed. My name is Chantel. I am from Marange village in Manikaland.
Murume anga akandiroora anga ine 37 years.
I was married at 15. My husband was 37 years.
And taipinda chechi yekwaMarange. So ndakandiri mukadzi number 5.
We attended the Marange church and I was the 5th wife.
So ndakaita school dropout. Ndaenda kuchikora ndiri form 3. Takatangodana ndiri form 2.
The relationship started when I was in form 2 and I fell pregnant and dropped out of school at form 3.
Zvadaro ndakaenda kumba kwaMwene. Ndaisangana nemasituation akasiyana-siyana, kurohwa, kutukwa.
I moved in with my mother-in-law, where I faced different forms of abuse. I used to be beaten. I used to be abused within that household.
Takagara ndobva ndaita nhumbi yangu yemwana wokutanga 2021 ndikazvarira kuchitsidzo.
I fell pregnant and I had my first child
And I went to get delivery support in an informal, I'm struggling with the word. Yes, informal religious antenatal care. Thank you.
Saka zvadaro vabereki vangu vaitomboediza kunditi adai uri umwe wasiya nezvemarriage noti makore ako achimadiki ndakatorwa kekutanga ndikatiza ndikadzokera.
My parents used to say, to advise me to leave the marriage, saying that I was still very young to be in that marriage, but I wanted to continue. I was taken by my parents to be taken out of the marriage, but I ran away and I went back to stay with my husband.
Zvadaro murume anga kandiroora ndo pakatanga kuchinja masituation ofu chipamba tati vakadzi 5 ka saka anga singachauye kumba kushungurudzwa nekushungurudzwa pabonde.
My husband started to change. He had 5 wives and he started not coming to visit or to stay with me. He used to abuse me sexually.
Saka ndaitoitawo kuti ndirarame ndaitoitawo zvekuita maricho kuti ndikwanise kuraramisa mwana wangu wandanga ndinaye.
For me to be able to survive, I used to do odd jobs, piece jobs in different places so that I could be able to fend for me and my child.
Saka ndakagara 2021 ndobva ndazoita imweni nhumbu 2024.
My first child was born in 2021, and then I had my second child in 2024.
Kwanga kuine outbreak yekolera saka ndakabatwa nekorera nhumbu yangu yani 9 months.
In 2024, there was a cholera outbreak that particular year, and I was sick. I had cholera.
Ndakazonobatsirwa kuchipatara zvoda ndakabva ndabuda marriage yandanga ndiri.
Okay. Because I had cholera, this time round, I managed to get care from the clinic for my pregnancy because I needed to be treated for the cholera. After that, I then left the marriage.
Ndakagara ndofunga 6 months ndisina chandaita ndobva ndazoona umwe mukadzi anonzi mai pachawo weMinistry of Women Affairs.
I stayed for 6 months without doing anything, without any source of income. After some time, I then met a woman from the Ministry of Women's Affairs.
Ndopa wakazondizivisawo kuti kune inonzi AHF ndobva ndatanga kuenda ikoko.
She then informed me that there is an organization called AHF who were providing support to survivors of child marriages. I then started going there to be able to get support.
Saka takatanga kudzidziswa mibato yemaoko, kusona, kugadzira madishwashi, sipo, vaseline nezvimwe zvakawanda. So ndo zvimwe zviri kundiraramisa nevana vangu vari vaviri.
We got training, vocational training at the center. I started being able to make soap, Vaseline, detergents, and to this day, this is how I survive with my 2 children.
Saka pandiri panapa nongoti kune ndinotodzidzisawo vanina vangu kuti muenzaniso munotoutora pandiri munofana kutoita zvinhu zvakarurama nokuti takabva neko hakuna chandakwanisa kuburisa marriage mandanga ndiri.
I also conduct peer education for my siblings and others in the community to say that there is no gain in terms of getting into early marriage or child marriage, and you'd rather wait and pursue your school.
Saka ndongoda kutenda kune AHF ana mukoma knowledge ana mukoma hope na sister delight wakandibatsira kundizivisawo kuti kune mibato yemaoko.
I would like to thank the team from AHF, the entire team who supported me and made me aware that I could survive through doing work for myself through the trainings that they gave us.
Ndongoti ndatenda hangu ndakabatsirikana makaita basa.
Thank you very much.
Thank you, Chantel, and thank you, Abigail. And thank you so much for sharing your story with us. And we are truly grateful. Another round of applause for Chantel. And during this moment, we are going to continue. We had the keynote address before we had our tea. So now we are going to have a response from a panel that is going to respond to the keynote address. And I'll introduce the moderator for this session. And the moderator for this session is none other than Chirisa Ishe-Anesu, who's the National Director of Women and Law in Southern Africa, Zimbabwe, with more than 2 decades of experience in gender justice, human rights and advocacy, policy, reform and institutional leadership. She holds a Master of Laws in Constitutional Law and Human Rights and has worked across national and regional international spaces to advance the rights of women and girls. Her leadership is grounded in the use of law not only as a mechanism for redress, but also as a tool for challenging the social, legal, and institutional structures that reproduce gender inequality. Under her leadership, WILSA Zimbabwe has continued to combine research, strategic litigation, community engagement, and police advocacy to confront the legal barriers that shape women's and girls' sexual reproductive lives. This work forms part of the wider effort to dismantle legal frameworks that treat age, marital status, or social position that grounds efforts to dismantle the legal frameworks. And it also highlights the need to move beyond formal and legal victories by ensuring that challenges in law are translated into accessible services, survivor-centered justice, and institutional accountability. Ishe-Anesu's experience speaks directly to the reproductive justice litigation Baraza's theme, age as a determinant of sexual and reproductive health and rights. Her work demonstrates how age can cooperate as a source of vulnerability when the law fails to recognize the realities of sexual violence, adolescent pregnancy, child marriage, and unequal access to healthcare. She brings to this Baraza a critical perspective on how litigation, advocacy, and policy reform can be used together to challenge age-based exclusion and secure legal institutional responses and that recognize girls and adolescents as right holders entitled to dignity, bodily autonomy, healthcare, and justice. Ishe-Anesu, have the floor.
She was far too kind. Please believe me, I never shared the resume with her. Yeah. Sometimes it takes days and hours for just a person's resume being read. Probably one key thing that she left out is that I was also involved, if not heavily involved, in the Clause 11, which the minister spoke about. It's unfortunate it died a still death, but the minister has assured us that the door is still open. We'll try to resuscitate it. So for those that do not know the famous Clause 11, it was a clause that we introduced through the Medical Services Amendment Bill to clarify the administrative issues around the legal grounds upon which termination of pregnancy can be obtained. So it passed in the parliament, the first house, we sailed through, we celebrated. And when it got to Senate, it became an African issue. It was an African. They said it failed the test. With that in mind, and with the keynote address given by Dr. Tatele, which key address I found very much deeply rooted, not only in data, but in lived experiences. I want to start off the session with key reflections that I'll pose to all of us, maybe in form of questions. Is the issue of sexual reproductive health rights fundamentally a moral question, or it's a health question? And what happens then when the moral judgment becomes a barrier to healthy care? Should a person's age determine their need for healthy care? Or rather, it should simply determine the health output or the health outcome they require. And then thirdly, when vulnerability increases with age and circumstance, should protection decrease? And then fourthly, now coming to the African test, do you think it is truly African to deny our own, especially the vulnerable, the right to healthy care around sexual reproductive health rights? And then lastly, but not least, what can the litigators, I'm a lawyer myself, do about this issue? What is the role of the African human rights system in protecting and according sexual reproductive health rights for all, especially the marginalized women and girls? To help me reflect on these key issues, I would like to welcome a very well-set panel to discuss with me today. So, help me to welcome one of our first panelists, Honorable Janet. Oh, she's online. Oh, our tech team, if you may help us to set accordingly. I think I need not introduce Honorable Janet. She has already been introduced. Please help me to welcome Dr. Akia, Dr. Brenda Akia. Last but not least, help me to welcome Ms. Bongile Ndashe. My key panelists, we are reminded to speak slower than usual because of the translation needs. All right. Are we ready with Honorable Janet? All right. She was going to set the tone. Do we have here online? I don't seem to have here. All right. So all right. You can use those ones. All right. So, okay, fine. All right, that's fine. Thank you. All right. She's coming. Oh. All right. Honorable Janet. Honorable Janet, can you hear me? All right. Yes, Honorable Janet, my name is Anesu. I'll be your moderator. If you can hear me, we're good to go. She's talking. Honorable, may you unmute yourself? You are speaking, but we cannot hear you. Oh my goodness. Maybe as we try to wait for her. Okay, there she comes. maybe we can change our chronology. We start with.
No, I don't want to speak after the other speakers. Please, I need to start because I need to leave. I have other things.
Oh, okay.
I think it's an IT issue.
No, that's fine. Thank you, Honorable Janet. It's good to have you.
Can you hear me now?
Yes.
Right, great, wonderful. Thank you.
All right.
I've been following the proceedings since this morning, actually, with interest, with keen interest.
Thank you, Honorable Janet. So I'll start off with you, and I'll pose a question. It's good that you've been following the proceedings, including the keynote address. My question, therefore, will be derived from the keynote address. You noted that the keynote argues that these age thresholds are a colonial inheritance, often mislabeled as African tradition and African custom. As the Commissioner's Special Rapporteur, do we still have you? Okay. So
I'm here, yes.
That's good, Honorable. So, Honorable, as our Commission Special Rapporteur on women's rights, does the continental normative framework bear that out? And where does the state resistance actually concentrate? Where do we see the resistance?
Thank you very much, Madam Moderator. I hope you can hear me.
Yes.
Loud and clear. Thank you so much. Madam Moderator, before I go to the response for the keynote, very brilliant keynote speech, allow me to commend AHAKI for convening the annual litigation Baraza on sexual and reproductive rights, and for meaningfully engaging the African Commission on Human and People's Rights, and including the mandate of the Special Report on the Rights of Women in Africa. Reaffirming our shared responsibility to advance and protect women's rights across the continent, while reinforcing the Baraza's relevance to the mechanisms of the Special Report on the Rights of Women in Africa. I think this is commendable. I was there in person with all of you last year in Uganda, and my profound apologies for not being able to be there in person this time, but I've been following with keen interest the opening ceremony and, of course, the powerful keynote statement delivered by a keynote speaker. And let me start by congratulating the keynote speaker for a very compelling and thought-provoking keynote. Madam Moderator, colleagues in the room, whilst I stand on the existing protocol, allow me to also recognize my fellow panelists. And I will start with Dr. Brenda Ake from the CEDAW Committee, a person that I collaborate with closely within the context of the work we do. And let me also take the opportunity to congratulate her for her election representing Africa in the CEDAW Committee. Congratulations, my dear sister Brenda. And we salute you and we congratulate you. Let me also recognize a fellow panelist, Ms. Sibongele Nashe, drawn from civil society, who I've had interactions with when I was also at the time part of civil society. Yes, I do have my roots in civil society. And I've worked with her, and I recognize and value her contribution in the human rights system in the continent. I don't think we could have had a better panel to respond to the keynote speech drawn from the regional mechanism, that is the African Commission on Human and People's Rights, from the global mechanism, CEDAW, and from our valued partners, civil society, ably represented by Sibongele, coming from an institution that litigates and advocates before the African Commission on Human and People's Rights and throughout the continent. So thank you very much for the opportunity. I think the address given by the keynote speaker reminds of a very simple but powerful truth, that age should shape protection and not determine rights. I think this is very important, that we have to recognize that. However, Madam Moderator, too often, age does exactly this opposite. I think across our continent, age determines who can access contraception, who can consent to healthcare, who can obtain safe abortion where permitted by law, because not in all countries that we have that, although we are campaigning actively for that, and whose bodily autonomy is respected. So whether a woman is considered too young or too old, age frequently becomes a barrier to the enjoyment of sexual and reproductive health rights. So just responding to the issues raised by our keynote speaker. From the perspective of the African Commission on Human and People's Rights, this is fundamentally an issue of equality, dignity, bodily autonomy, and access to justice. And I think, as rightly observed by our keynote speaker, the good news is that Africa already possesses a very strong normative framework to address these challenges. What is very clear, Madam Moderator, is that long before the language of life course approach became widely used, the Maputo Protocol had already embraced it. The protocol recognizes that while women face different vulnerabilities at different stages of life, their rights remain constant throughout. The relevant articles of the Maputo Protocol deal with the issues that have been highlighted by our keynote speaker. Article 6 protects girls by setting the minimum age of marriage at 18. Article 14 guarantees sexual and reproductive rights. And Article 22 recognizes the rights and protection needs of older women. What is clear is, read together, this provision affirms a simple but profound principle that women's rights do not diminish with age. They accompany women throughout their lives. So this life approach is particularly evident in addressing some of the harmful practices that we have, female genital mutilation and early and child marriage. Listening to the voice of the survivor narrating her journey reinforces the issue that we are talking about. I think it's not only about young people and adolescents. The consequences have a lasting and a lifetime effect on adult women who also remain vulnerable to the practice, as actually reinforced by the keynote speaker. I think the Maputo Protocol has extensive provisions. I don't need to repeat them because it's like preaching to the converted. We are all very familiar with it. Article 5 of the protocol prohibits all forms of FGM. And what have we done at the African Commission? I think it's important in responding to the keynote speech also to recognize what we've done. The African Commission and the African Committee of Experts on the Rights and Welfare of the Child has adopted a joint general comment on the eradication of the FGM. Building on what we have in the Maputo Protocol, we've elaborated on the right. And we have emphasized the fact that criminalization is not enough, because we have a lot of laws. I think you're asking the questions, why are states resisting? Not that states are resisting. In some of the states, we do have the laws, we do have the policies. But then the challenge we have is that we're still having problems. Even as we talk about the jurisprudence also, some of the issues that we have, groundbreaking jurisprudence on, are still happening in the continent. I think what we do at the African Commission is, in our joint general comments, we demand a survivor-centered approach and support. We also deal with community engagement, education, adequate financing, regional cooperation, and accountability. Because we have realized that we have a lot of countries that have very far-reaching commitments in terms of laws and policies, but yet still, in plain view, these violations are happening. I think apart from the joint general comment on the female genital mutilation, we also have a general comment number 2 on Article 14 of the Maputo Protocol, which also deals with the issues that are highlighted in the keynote speech, and recognize that legal rights are insufficient in women continue to face structural barriers based on age, disability, marital status, poverty, or place of residence. So these joint general comments that we have elaborate on the rights that are provided in the Maputo Protocol. And we use them to guide states in implementing the relevant provisions of the protocol. I think apart from the joint general comment on the FGM, general comment number 2, we also have another joint general comment on child marriage. Speaking to the issues relevant to this, the theme of this Baraza, we recognize that child marriage both as a violation of a girl's right and a structural driver of other rights violation, adolescent pregnancy, maternal mortality, and the denial of sexual and reproductive autonomy. I think what is clear is this instrument demonstrated important evolution in the African human rights system. The question is no longer whether the rights exist in law. The question is whether women and girls can realize those rights in practice. What is of utmost importance and relevance to this Baraza is the fact that despite the normative framework, despite the laws that we have at the national level, this Article 14 that deals with sexual and reproductive rights is one of the most reserved rights. So the problem is in Article 14 in terms of implementation. Whereas it promotes and is transformative, ironically, is one of the most transformative, is one of the most reserved rights, which limits the enjoyment of women's rights in several state parties. And I think in recognition of this, the African Commission responded together with partners. And we adopted an advocacy framework for the withdrawal of reservation to the Maputo Protocol. The framework provides practical guidance to support states in progressively withdrawing reservation that undermine the full implementation of women's rights and reflects an important principle. The reservation should never become permanent barriers to enjoyment of rights guaranteed under the protocol. So as we talk about states resisting also, we have to also avert our mind to states that have actually ratified but have entered reservations. And we need to do something about it. And also, even in countries where you have the laws, the moderator, these laws are not being litigated. Our experience at the African Commission is the fact that despite the massive and gross violation, states taking action in terms of ratification, taking action in terms of domestication, but matters are not being litigated. And this is the reason why we actually champion a tripartite study on challenges of litigating women's and girls' rights before the African human rights organs. And this was a study between the Commission, the committee, and the court. And we tried to identify practical barriers that continue to prevent women and girls from access to justice and propose concrete measures to strengthen litigation and accountability. I think these initiatives demonstrate an important shift in the Commission's work from developing standards to ensuring implementation. We are moving towards implementation because we recognize that this is where the problem is. So today's keynote reminds us that age-based discrimination does not end with adolescence. Of course, older women continue to experience exclusion from sexual and reproductive health care, as has been rightly highlighted. And that is why the Maputo Protocol, through Article 22, deals with the rights of older persons in Africa. And this further reminds that older women remain rights holders entitled to dignity, autonomy, equality, and access to appropriate health care throughout their lives. I think what is important is, you talked about the issue of resistance. One thing we've reaffirmed at the African Commission is that sexual and reproductive health rights that are enshrined in the Maputo Protocol are firmly rooted in the African human rights system and the continent's commitment to dignity, equality, and justice. Assertion that these protections are contrary to African values reflect narratives shaped by, as has been rightly said by the keynote speaker, our colonial, legal, and societal legacies, rather than the principles and aspirations embodied in our own African human rights instrument. Our keynote speaker said, whose values? Whose values? And I underscored and noted that these are not our values. And we have reaffirmed and reinforced this in our own jurisprudence, actually, in the African Commission. We have the case of Senate Masufa and others versus Kingdom of Lesotho, where the Commission was asked to determine whether the exclusion of firstborn daughters from succeeding to hereditary achievement could be justified as the basis of customary law. It doesn't deal with sexual and reproductive health rights, but it deals with discrimination. And it is important to know that the Commission actually affirmed that customs and tradition cannot be relied upon to justify discrimination based solely on gender or sex, and must be interpreted consistently with both the African Charter and the Maputo Protocol. So in answering your question, the challenge before us is no longer the absence of legal standards. Africa has one of the most strongest normative framework for protecting women's rights. But our challenge is implementation. Our challenge is ensuring that not only do states need to ratify, not only do states need to domesticate and also implement, but it is to ensure that our national legislation are interpreted by our courts in a manner that incorporates transformative remedies for women and girls across our continent. We are celebrating the Mazuru jurisprudence and so many other jurisprudence in other parts of the continent. But I keep reiterating that this jurisprudence, the laws, the policies, are sitting on the cultural values. I use the cultural values in quote, what is termed as cultural values, or the perception that these are our cultural values. And this is the problem we have in our continent. So that's why attempts even to implement are actually met with resistance because of the wrong perception. And I think this is where the decolonization narrative becomes very important. Is this our true African value, or are these values that were imported through colonialism, through slavery, or through fundamentalism? Because in the past, we were talking about what happened in the past, but today we actually have to be, we are confronted with what is happening presently. Fundamentalism and populism, which has its roots outside the continent, unfortunately. And it's being fed into our policy organs, both at the national level and at the continental level. And these are some of the challenges that we actually have to contend with. We can have progressive jurisprudence, we can have progressive laws, but attempts to implement them may lead to backlash, as we had the experience in the Gambia, where we had a very progressive law against FGM, but the attempt to implement it gave rise to backlash and a whole attempt to roll back on the law prohibiting FGM in the Gambia. Also, where you have good jurisprudence also established by the courts, implementing that jurisdiction may lead to ostracism by society of the beneficiaries of the jurisprudence. So these are some of the challenges we have. And one of the things I recognized today is the fact that things that were even traditional in nature, and culture evolves. Culture is not static. Culture evolves with society. But today, people are using religion. For example, the practice of FGM. And people use religion. And when it comes to religious beliefs, it becomes very sensitive. So our task and our challenge is to ensure that we package the advocacy that we do, reinforce and recognize the fact that sexual and reproductive health rights provisions in the Maputo Protocol are not un-African. The Maputo Protocol is an African document, championed by Africans, adopted by Africans, and must be implemented by Africans. And we must debunk the myth that what we have in the protocol is not African. So allow me to conclude with one final reflection, that today's discussion is ultimately not only about age, it's about whether we accept that dignity has an age limit. Do we accept that dignity has an age limit? You ask questions, I'm also asking the questions also. I think what is clear that the African Human Rights System has already answered that question, and that the answer is no. Dignity has no age limit. A girl's dignity matters, a young woman's dignity matters, an older woman's dignity matters. Their health matters, their autonomy matters, and their choices matter. So our collective response is therefore clear. We must, in line with the AU motto, leave no one behind, and we work collectively. And we must ensure that age is never used as a justification for exclusion, discrimination, or denial of health care. Instead, age should guide states in providing protection, support, services for women that is at every stage of their life to enjoy their rights fully, equally, and with dignity. If age determines access to rights, equality becomes conditional. I think this is something that we have to reinforce. But if age guides protection, while rights remain universal, then justice becomes possible. This is the promise of the Maputo Protocol. And I also say this is the vision of the African Commission, and by extension, the African Union. And that is our shared responsibility. That is the African Commission, as an organ of the AU, the African Union, our regional colleagues, our global colleagues, our valued partners of civil society, working together to deal with the challenges that we are confronted with today. And we're not taking these challenges lightly. I think the keynote speaker highlighted the fact that some of these convenings are happening in our lawmaking legislature. And that is where laws are being made. So we must ensure that measures that we adopt to counter that narrative are apt, apposite, relevant, are able to actually highlight the fact that the laws we have, the policies we have, the rights we have in our instrument are not against African values, tradition and culture, but they're in sync and aligned with our values. And this will require a thorough analysis, a deep analysis that we are all engaged in doing. And we must prepare ourselves properly, because we talk about an instrument that is being championed. So we prepare ourselves properly so that we are able to actually define and control the narrative, as opposed to allowing external stakeholders to control the narrative for us. And this will involve an integrated approach that ensures that states, communities, civil society, national human rights institutions, lawyers, bar associations, the judiciary, community, and traditional leaders are all on board. Because the anti-rights movement is getting very strategic, and we must also ensure that our response is also very strategic and hits at the very nerve, at the center of what they're trying to do, and ensure that they will not succeed. So this is the perspective of the African Commission, and of course reinforcing the fact that we as a commission recognize the fact that the rights that we promote, especially the mechanisms of special rapporteur, are not on African rights. They're based on our own instrument, which actually recognizes positive cultural context, in fact. So this is what I would like to contribute, Madam Moderator, and I thank you all.
Thank you so much, Honorable Janet. Indeed, critical reflections. Can human dignity be attached to a particular age? And you put it very simple. Simple, age should shape the needed protection. Thank you once again, Honorable Janet. It will be good if you are able to stick around. Probably the delegates may want to interact with you through a couple of questions. So maybe if you may just stick around as I take our second panelist. Thank you once again.
Right, okay.
Thank you. My second panelist would be Dr. Akia. Honorable Brenda, Dr. Akia is the Vice Chairperson and Rapporteur of the UN CEDAW Committee. Dr. Akia, thank you for coming, and thank you for the expertise you're bringing today. So my question to you would be, from the keynote, we noted that a girl of 16 and a woman of 80 years, 80, they face the same mechanism. Does the CEDAW jurisprudence already say something about this? If so, why is it not cited in the way the litigation outpans? You need this one. Okay.
I think I just want to go stand there because I want to see everyone in the room. Thank you very much, moderator. And I will start by saying, of course, the distinguished excellencies. I know we have judges in the room, we have the minister, and of course I will say I already stand on existing protocol that has been established. I'd also like to thank the organizers of this event, and also especially all of you who work on sexual and reproductive health rights, because your perspectives remain very critical for the work that we continue to do. But before I go on, I'd like to, because we are hosted by the government of Zimbabwe, and I have my mandate because of countries like Zimbabwe. So I'd like to thank the government of Zimbabwe for hosting us, but also importantly for voting for me in New York as I got my second mandate. Thank you. The panelists, of course, my sister, Honorable Janet, who we work very closely with because CEDAW has 52 African countries who are member states. I'm sure we are all familiar with the CEDAW committee. Yeah? United Nations Committee on the Elimination of Discrimination Against Women. So we work very closely, and also we are part of the EDVAL platform. It is an honor to be on the same panel with you. And of course, my sister Simbogile, who is also representing civil society, whose work continues to shape the jurisprudence of Africa. Those from Uganda, I don't know if any of you heard this story. In April, there's a 25-year-old lady called Ashley, I know Mugisha, who came out to say when she's 25, yeah? So she came out to say when she was 24, she had tubal ligation. Can you imagine the backlash she got? Imagine the whole social media. She set social media on fire. I don't know, any of you hear that story? Do you remember the backlash that happened? She got terrible backlash, was hosted on the news. Everyone was appalled by how she could have this procedure at 24. Interestingly, even I have a friend who is 60 years. She has children who are in college, university. She went to her OBGYN to schedule the same procedure. Do you know what the OBGYN told her? Refused and said, no, there are people who have children at 65. I'm not going to do this procedure. Please note, a 24-year-old is having the same backlash. A 60-year-old with kids is having the same backlash in terms of the doctor saying no. So the doctor said, you go back, think about it, and come back. Each time she tried to schedule an appointment, what happened? He kept dodging her. So you see how women and girls, irrespective of your age, the choices that you make on your own bodies continues to be governed by people outside your own body. So when you look at the existing gender gaps, be it in health or any other decision-making, energy, it seems to indicate that no matter the age, because when you look at the gender gaps, health, it is very clear. No matter the age, women and girls, no matter how old you are, we are not winning. Right? We are not winning. So that is why conversations that we have here remain very critical, because it is the voices that we get and the solutions and the strategies that we get that help us move forward, continue to push for change. Because we must recognize where we were before is not where we are now. We have achieved some progress, although right now we are having the backlash. On the CEDAW committee, we have also observed that the impact of gender discrimination accumulates throughout women's lives, especially with severe consequences in older age. The stigma against women's aging is based on the belief that older women are no longer reproductively useful or productive in society beyond their gendered and age-based roles in the family. We say younger girls, teenagers, also don't have the right capacity to make decisions around their sexual health. So because of all these narratives around women and girls, I guess we all know that the current backlash, that 1 in every 4 countries is experiencing backlash against women and girls to equality, including in relation to women's sexual and reproductive health. That brings us to what Honorable Janet spoke about, and also what the keynote speaker, doctor, said. The high gear conversation around the African Union Charter on family, sovereignty, and African values. I want to pose a question. On top of just hearing, how many of us have read the provisions in this charter? How many? 1 in the room? 2? How many are we in here? 3, 4, 5. And we're about 150 here. And only 5 have read. What does that mean? You need to go and read, because for you to be able to push back against the backlash in that charter, if there is any, you need to have the knowledge of what's in there, so that you develop strategies that are able to counter the narrative in case there is any narrative in there that undermines sexual and reproductive health and rights. So, moderator, the homework is, please go read that, so that I think at the end of this conversation we should be able, because it's in high gear. Keynote address said that, first, of course, Uganda, but I must say, when I went to the Ministry of Justice, I went to the Ministry of Justice, the minister himself, the ministry, the Attorney General, many of them do not know about this charter. But the conversations are happening. Accra held a conversation hosted. So what is exactly happening around this charter? That is something we need as practitioners, we need to push. We need to know exactly, because if you have no knowledge on what's in a charter, if you don't know what is exactly where the procedure is, it means they're going to pass it without you knowing, and it comes back to haunt us. So please, I would love to really say that we need to establish, because Article 12 of the Convention and Article 14 of Maputo is clear on women and girls' rights to health. So it's important for us to know that. Then the other question, the other thing is from my experience, right now, I think I mention this all the time, there is a rejection of the words intersectionality. When you're working on sexual and reproductive health and rights, irrespective of the age, many African countries are saying, we do not want to hear the word intersectionality. How are you working on sexual and reproductive health rights if you do not speak to intersectionality? But here we are, some countries saying, we don't want to hear intersectionality, we don't want to hear the word gender. Why are they saying this? Because they are worried that it goes against African values in terms of promoting the agenda of LGBT. Please complete the acronym in case I get it wrong. So you have to realize that when you're looking at CEDAW, and of course Maputo, it caters for all women of all ages, whether you're women with disabilities, whether you're a refugee, whether you're a migrant, asylum seeker. It is important that we need to understand how can we navigate the express rejections of the words intersectionality, gender, to be able to push effective implementation of sexual and reproductive health and rights for women and girls. This reminds me, on our continent, this, not only continent, I think everywhere, again from the CEDAW, I have a 360 view of many countries, 189 countries. There's this famous Bible verse, that's Genesis 1:28. God tells Adam and Eve to be fruitful, multiply, and fill the earth. We Africans have grabbed that verse and said that is African values. We cannot have abortion, no family planning. So we are using that verse to reject the narrative of family planning, sexual and reproductive health rights. And then also I think, so it's important for us to continue to develop the strategies, and this is what we realize on the CEDAW Convention, and that is why they keep pushing for things like child marriage, because yes, as soon as you start your period, you're ready to go and multiply and be fruitful. So it's important that we keep countering that narrative. Then something that we see on the committee also from our jurisprudence, okay, I already talked about that, is that doctors, how they have gendered assumption. Some about women's bodies. I told you my 60-year-old friend was told first go back and think, and each time she wanted to come back for the procedure, the doctor is dodging her to schedule the appointment for the procedure. But there's something very important that the continent, we as Africa, because, and I understand, I do know our colleagues from Latin America and different parts of the world are here, but it is something I'm very passionate about is energy and electricity. How are we talking about increasing awareness about sexual and reproductive health rights when 3/4 of Africa is in darkness? We don't have reliable electricity. We're talking about technology, increasing social media presence on talking about sexual and reproductive health rights, but people don't have access to electricity to even power their phones. Solar is expensive, we can't access radios. So you see how this aspect of electricity, I think what is missing is how do we link energy, access to electricity to aspects of sexual and reproductive rights for all women and girls. How can we navigate those challenges? Because I think the statistics just that over 640 million Africans have no access to electricity, energy in Africa. So we need to increase awareness on sexual and reproductive health. The fastest way is through radio, TV, social media, but no electricity. So it's something that we really need to think about. And on the committee, CEDAW committee, we really want to always link the different conversations to electricity. Then the aspects of, as Honorable Janet said, governments are the ones that draft these international and regional instruments. Governments draft the CEDAW Convention, governments draft the Maputo Protocol, governments draft all the current existing international framework that happen. These are their instruments. That means it is their commitment to women and girls of all ages. It also means that it is them who have the mandate to implement. But what is happening? They all are not implementing. They are instead facilitating the backlash on women and girls' rights that goes exactly against the same commitments they made in CEDAW, in Maputo, and pending or continuing international instruments they are working on. So as practitioners here, how are we going to work and try to navigate governments to say, You ratified these instruments. You drafted them. How can we assist you to implement them so that women of all ages can enjoy their sexual and reproductive rights? One of the very creative ways, which I don't often see practitioners use, and what we use on the CEDAW committee, is reference to the Vienna Convention. You know, most of these Maputo, CEDAW were made in times when maybe different contexts. You see, right now we are seeing new emerging abuses on women and girls, sexual and reproductive health rights, but the Vienna Convention allows you to put pressure on your governments, or allows us on the committee to interpret these international instruments progressively, irrespective of the fact that it has not mentioned, let's say, if as Maputo or CEDAW has not mentioned something that is pertinent to, let's say, cyber violence or cyber crime against women and girls. You can use the Vienna Convention. So in your work, as you're doing strategic litigation and you cite the Maputo, you cite CEDAW, also remember to cite the Vienna Convention, because when you're using that, for you to interpret these statutes, the first point of reference is Article 31 and 32. So this is my plea to you, and that is what we use on the CEDAW to really try to be progressive. And lastly, I think to say about the CEDAW Convention, because your question, briefly, of course, the CEDAW Committee has 189 state parties, and 52 of those are African countries, meaning it's important for us to work with Honorable Janet and to work with the African Union, because what we push at the regional level, what they push at the regional level is also what we need to push for at the international level. And we hold those governments accountable. We develop international jurisprudence, we have constructive dialogues with state parties, and when state parties come, we're asking them different questions on sexual and reproductive health rights. That's abortion, that's or for older women, for refugees. So I'd love to implore all of you to go look at the constructive dialogues that we have. And something important is CEDAW is developing an addendum to the health, and it's an addendum to General Recommendation 24. Please go look at it. We are still receiving comments for that. So please feel free, from the conclusions that you have here, from the outcomes, to submit those to the CEDAW committee so that we are able to see how we can ensure that the context of Africa or of Latin America or of all the countries that are here are reflected. So please, that is homework. On top of reading and finding the provisions on the Charter of African Values, please also try to submit that to the CEDAW committee. Then also we do have Addendum 30, which was on women, peace and security, because sexual and reproductive health and rights don't stop during conflict or post-conflict or humanitarian settings. So please go read that, and we look at women of all ages, including older women. Then, of course, we have upcoming General Recommendation 41 on stereotypes. You know, all these stereotypes fuel gender inequality, fuel dismissal on women and girls' sexual and reproductive rights, and it's what many governments many people use to undermine women and girls' sexual and reproductive health and rights. So we also have communications, because CEDAW is a quasi-judicial body, but for you to maximize this communication procedure, your country has to have ratified the optional protocol to the CEDAW Convention. So you need to go and find out, has my country ratified the optional protocol to CEDAW? If yes, what does that mean? It means if there's a violation in your country, or if you feel that your right has been violated, and then 1, you exhaust all domestic remedies. 2, you can be able to file your complaint with the CEDAW committee. And I know Latin America is very vigilant in utilizing this procedure, and we've had so many decisions on sexual and reproductive health rights that I'd love to encourage all of you to go and be able to read, so that you can see how do you apply the outcomes and the decisions made by CEDAW, even the constructive recommendations, the general recommendations that you make, how can you use them? Because that's international jurisprudence, and you can use that information to hold your governments accountable on ground. When you're doing strategic litigation, you can use those same outcomes or recommendations to influence the decision to go in your favor. So lastly, to the organizers of the Baraza, we are thankful for these conversations. I bring greetings from my colleagues on the CEDAW, and as we have these conversations, let us continue to remind our governments that for them to achieve the African Union Agenda 2063, or for them to achieve the development and the sustainable peace that they desire to achieve, they will not be able to do it without the maximum participation of women and girls of all ages on equal terms with men and boys.
Thank you, Dr. Brenda. I think it's clear now that both at international and regional, the normative frameworks are very strong, but the gap lies in implementation. And Ms. Bongile, this speaks directly to you. So, dear delegates, assist me to welcome Ms. Bongile Ndashe, the founder and executive director at Initiative for Strategic Litigation in Africa. At the stage at which Dr. Brenda posed, the question was created directly to you. How do we close the gap? And my specific question, Ms. Ndashe, would be, you have had the keynote, and we immediately facing instruments like the Draft African Charter on the protection of family sovereignty and values. They pose as colonial inheritance, labeled as tradition. And from your perspective, as a strategic litigation specialist, how do we get ahead of an instrument like this before it gets the domestic traction, if it's not already getting that? How do we go ahead of it? Over to you, Ms. Ndashe.
Good afternoon. I stand on established protocol, and I am going to disagree on the normative standards that are supposedly strong. We are assailed, we are under attack. What we have been building over 3 decades is not only attacked by this mentioned draft charter, there are many forms of attacks, and that's what I'm going to talk about. The Muzuru case is an example of good jurisprudence that can only be possible where litigants can pull from international, regional, and national standards. When we talk about standards, we're talking about standards and legal frameworks that are rights-based, align with normative standards, and are coherent in that they do not fragment the human rights architecture. My interventions will be based on 3 things. I'm going to talk about clarity in drafting, which the Matsuru case recognized. I am going to talk about gender-neutral frameworks to build on the conversation around the pushback against intersectionality and the recognition of violence as a form of discrimination. Because when we are talking about child marriages, we are talking about gender-based violence as well. And finally, I will end with a call to action, which is about defending our gains. Because if we do not stand firm against these attacks, then we are going to lose. So in the Muturu case, what happens, the Constitutional Court of Zimbabwe points us to the intentional vagueness in the Convention on the Rights of the Child. The court notes as follows: the CRC contains no explicit provision on marriage, which is odd, if not downright baffling. Article 1 of the CRC provides that a child means every human being below the age of 18 years, unless the law applicable to the child majority is attained earlier. the word majority is deliberately not defined in the CRC and is left to local law to determine. Consider how problematic this provision is in the case of a married female child. And indeed, many domestic laws explicitly provide that a person attains majority upon marriage, regardless of age. Close quote. This is what the Constitutional Court is saying about the lacuna that is left there deliberately. This lacuna was cured on the regional level by the African Charter on the Rights and Welfare of the Child. Because the point that I want to make here is that the CRC's failure to define majority is noted by the Constitutional Court as baffling because of what the ramifications on the domestic level would then be, putting children, especially girls, in danger of child marriage. That is why the definitional problems in the African Union Convention on Ending Violence Against Women and Girls is something that I want to put here on the table. This convention, Article 1, defines family as a natural and fundamental group or unit of society as defined or provided for by a state party. Do you understand the word provided for by a state party? That's a definition of family in a regional convention. You understand, as law people, as litigators, where we are going with that. The removal of family from regional and international protection and putting it under national, whatever the member state says. That's not what we do with definitions, but this is what they did here. We are going back to the lacuna of the CRC, right? The central legal concern with this definition is that it departs fundamentally from accepted thrifty drafting practices by using the definitional clauses not to clarify legal meaning, but to advance ideological positions and delegitimize existing human rights standards. When you are saying a family is as provided for under national law, you have done a lot of erasure from whatever it is that we have been trying to build all of these years, and you have gone and incited the word provided for in a definition. That's not an elaboration of a family. The issue with this definition is twofold, this convention. It leaves the definition of family to states, thereby allowing restrictive national interpretations. But secondly, this convention is a gateway to the draft charter. You know, when young people are experimenting with drugs, sometimes they sniff glue. And they say this glue is a gateway to strong drugs. This convention opens the door to the thing that all the speakers have mentioned here, the fear of this draft charter on family values because of what it says about family values. But this convention actually is taking us there, that some member states actually want to define what these family values are. This draft charter is telling member states to withdraw from all treaties that are inconsistent with the draft charter. But this convention, by putting a definition like that, has already done that. So why do we fear the draft charter on family values when we are urging ratification of this convention that basically leaves the door open for this draft charter on family values? Let's take Egypt example. In mid-April 2026, the prosecution announced via its official Facebook page that it had issued an arrest warrant for an unspecified number of individuals on the grounds that they had breached a publication ban issued by the public prosecution itself. They had reported on cases pending before the courts that deal with child sexual violence in the family, because the Egyptian authorities are now saying that's against family values to talk about things that happens in family. People thought family values were against LGBTQI people. Family values are coming after everything that we want. You can't report that's freedom of expression. You cannot talk about sexual violence, all to preserve this family that violates its children, that forces its girls to go and get married at the age of 12. We have a convention that's about ending violence against women and girls that's basically taking us to Taliban land. I want us to go and talk about the gender-neutral frameworks that are a red flag. The Constitutional Court in Muzuru case acknowledges that there is a need to fully acknowledge that a child's gender can detrimentally affect the realization of his or her right. And in acknowledging the CRC's gender-neutral drafting, the court cites Joel Amoa in Academics article in providing that the failure to make specific reference to the girl child and conditions that exacerbates her vulnerability is itself a form of discrimination against her. It's not enough that the language simply be gender neutral, but where there are specific gendered human rights abuses, then these must be directly addressed. So what the Constitutional Court does, it acknowledges gendered human rights abuses exist, and this is something that many courts struggle to understand. Courts struggle to understand these frameworks, and then having this gendered framework as part of treaties is useful in equipping litigators with tools that will lead to progressive judgments. This Convention on Ending Violence Against Women and Girls fails to ground the right to freedom from violence in the right to non-discrimination as recognized in the Maputo Protocol. Without a non-discrimination clause, these child marriages that we're talking about, states end up treating them as social or criminal issues rather than structural human rights violations rooted in gender inequality. The framework is violence as discrimination, and the Convention's failure to recognize gender-based violence as a form of discrimination is a missed opportunity. Gender-based violence is a form of discrimination which has been set as a normative standard. The CEDAW Committee, in its General Recommendation number 19 and number 35, made this decisive link between violence and discrimination, that this is gendered. I am going to do a little flex here, going through the jurisprudence of the African Commission. In 2013, in a case against Egypt, the African Commission had its first judgment, which I worked on, that's my flex, and it recognized that gender-based violence is a form of discrimination. A few years later, in a case against Ethiopia, the African Commission went and reversed this very judgment and said we needed to have a comparator. It was a case, child abduction for the purposes of marriage against Ethiopia, and it said you needed to have a comparator. In this Africa of ours, where do you find boys abducted for marriage now that we are going to compare this? But this spoke to a failure to understand that this violence is discrimination because it is overwhelmingly gendered specific, in that it disproportionately targets women and girls than boys and men. Not that we needed to go and actually compare. My second flex, we went back to the African Commission with lots of pages to say, we need you to correct yourself. You were wrong in the Ethiopian case. This violence is gendered and it is discrimination, and we want you to go back and correct yourself. We received our decision in J versus Namibia. They corrected themselves again. I am raising these examples to say When you don't have normative standards that are very clear, that are legally binding, we have to keep on doing this tug of war. The same problem that we have at the African Commission is exactly the same problem that people that litigate before ECOWAS have seen, where the mechanism struggles to understand this violence as gendered in the same way that it also struggles to understand that violence that happens in the private sphere should be attributed to the state, the due diligence obligations. Having started with a problem with family, and then mentioning this problem with gendered discrimination and the due diligence obligations, the Convention on Ending Violence Against Women and Girls do not have these things. It does not even mention child marriage, FGM, the forms of violence that are prevalent in this continent. So which kind of violence is this trying to solve? It decimates established human rights frameworks. You find them in fragments. If you go to Article 5 looking for state obligations as we know them to end violence, it's not there. So if we are serious about child marriage and dealing with age as a determinant, we are not going to be able to look at this new convention to do that. But what this convention is going to do to us is to tell us, because it's already said that whatever member states say about family, so if people want to marry their kids at 6 years old, at 10 years old, they can do that because this convention actually tells them. So on your last point, your question, the call to action, how do we then move from this? The African Commission was in Zimbabwe and the government committed to ratifying this convention. I have given you reasons not to. Do not push for ratification of a convention that takes us many years back. We are talking about a decolonial kind of outlook. Women in law in Southern Africa existed in 10 countries, and one of its missions was to do away with the clawback clause, a clause that we were given by the British when we got our independence that said the equality provision does not apply in family law, personal laws, and customary laws. We fought in our second wave and third waves of constitution in this continent. African women said, we don't want this, that makes us second-class citizens. This definition of family takes us back to where the British tried to push us. We cannot accept to be defined the way member states want to define it in the absence of international law. We must rage against anything that actually puts us in that position because we fought through Maputo, we fought and all of that. That's not the kind of progress we want to see. So we mustn't be scared of the animal that's still out there that is called the draft charter on family values. Inside our house, inside our legal instruments, we already have serious normative regression that some of us, institutions that have got mandates to protect us from violence, are pushing for its ratification. If we are serious about what we are saying there, we are going to ensure that we don't fragment the African human rights architecture, that we insist that normative regression is not our portion, and that whatever it is that we call progress builds on what exists but does not take us back. I thank you.
Thank you, Ms. Ndashe, for very candid reflections. I am very happy that we still have Honorable Janet. Honorable, you still there? Okay. It would have been good if she was still here to get some of these reflections. At this juncture, I would want to open a dialogue conversation with our panelists. Any points of reflections, comments, and maybe clarifications. So let's make our comments, questions very clear and indicate to which panel you're directing that. Yeah, we'll take a round and I'll allow the panelists to respond. Someone to help with the mic. Sorry, do we have anyone with any questions? Or people want to go for lunch? Oh, there's a question? Okay.
Hi.
Yes.
Yeah, thank you very much. My name is Segane Musisi. I'm from Uganda. I'm directing this to any of the panelists, so all of them, including all the lawyers here, the justices. I've heard where the problem is. And my thinking is that we have our legislators, our members of parliament, our lawyers, our justices, having colonial minds to interpret our African questions. And until we free us ourselves, Afrocentrically, from these colonial minds and education that we've had, we shall have all the failures that we are experiencing, including what our speakers are talking about, including Clause 11, and all of these things, because these people are interpreting things, and I've heard many Africans embarrass us, genuine Africans on the African continent internationally, by quoting foreign imposed ideologies, Bibles, Korans, whatever it is, to try to interpret our African values. When are we going back to Ubuntu? To be very authentic in how we go ahead with whatever we want to do. Thank you.
Okay. My panelists, any of you could take the question. It seems like it's the only question we do have. Oh. Sorry?
Okay. What we are dealing with now is what I call normative capture. And the discourse itself, where we are having the decolonial kind of conversation, has been taken over. Because when we continue this conference and talk about the substance of the draft charter, is where you see that sovereignty is basically a word to evade accountability. Human rights themselves are called foreign ideologies, right? The African Charter itself, the Maputo Protocol, all of these things that African governments developed themselves are now called foreign ideologies. So that's why there is this idea in this draft charter that Africans, to be truly African, must actually reject what we have fought for. So it's not as easy or as kind of neat as it used to be, that it's like people are using like the verse from the Bible, you know, to interpret reproductive justice autonomy. It's because everyone is saying, I am the one that speaks best for Africa. You know, I am the one who actually understands what Ubuntu is and what values. Like, if you go to this draft charter, is that there is a definition of Ubuntu, which is not Ubuntu the way we have known it, and like, I am because you are, you know, that our humanity is connected. So the answer really is going back means something else. And I think this is what this whole disinformation campaign by fascist, authoritarian, and kind of right-wing forces have been doing, which is about flood the zone. So every idea, every meaning becomes contested. And that's why we are seeing this norm entrepreneurship, people trying to put kind of conflicting normative and human rights standards so that everything, meaning is up for grabs. So whoever it is wants to assert, this is African, then you will have different versions of what being African is, and then that survival, you know, of the fittest. And that's why you are seeing this in the convention, the definition of family, and you are seeing it as well in this. I mean, if you look at this draft charter, they're actually setting up a parallel human rights system which will compete with the African Commission, you know, as an implementing and monitoring body. They have got their family impact lens. So we are moving from rights-based to kind of value-based governance, you know, in terms of the normative frameworks that they are putting in place. So we have to really move with where the conversation is, that trying to ascertain the meaning of what Africa is and what it means to be African and what our values are have been intentionally kind of being put in this position that we all have to fight for the various meanings that we are asserting.
Thank you, Ms. Bongile. Unfortunately, we have to end now. Otherwise, people will kill me when I walk outside. He said, of course. Okay. Or you want to say something? But just quickly.
Thank you. I just want to
Hello.
add. I just wanted to add also, because he did address to judges, and I know Justice Eva Luswata is here, and she's very progressive when it comes to judicial activism. Here, where judges are expected to look beyond strict interpretation of the law. So that is one thing also that judges can be able to do. But it also strongly comes down to political will. Because if you're a politician, I know when I was traveling across Africa, you go to a country and you find a 9-year-old who is being forced into marriage. And does it need to take a convention? Does it need to take a treaty or your police officer to tell you that your 9-year-old daughter shouldn't get married? So those are things where we are saying, one, judicial activism, but also political will to be able to ensure that some of these narratives are a thing of the past.
Okay, thank you. Honorable
Hello.
Janet. Oh, all right. So, Honorable Janet, just a minute. Over to you.
Thank you very much, Madam Moderator, and thank you to fellow panelists for raising very pertinent issues relevant to the theme of this convening, which is the issue of age and how this affects sexual reproductive health rights. I think what is very clear is the fact that despite the very progressive normative framework we have at the continental level, at the regional level, and the jurisprudence, as ably highlighted by one of our panelists, because the jurisprudence at the African Commission today, as we speak, has progressed from the comparative principle to dealing with substantive equality. And I had the rare privilege of being part of the decision that actually moved away from the comparative principle to where we are today. And since that case also, we've actually adjudicated on so many other cases where we've actually upheld the issue of substantive equality as opposed to the comparative principle. So that is where we are today as the African Commission, confirming that as we speak today, we're ready and willing and able to adopt a very progressive approach to interpreting instruments that we have responsibility for, especially where the instrument itself actually enjoins us, because it's a provision in the instrument that says you must interpret progressively. So we don't even have a choice in moving backwards. So this is what it is. And also recognizing the fact that these instruments that we have are instruments that are negotiated and adopted by the member states. What we have responsibility for and what we have control over is how we interpret those instruments to the best interest of the girl child, of the women, of the continent. So my ask is, one thing I know we have in common, all the panelists, and I speak, and I can beat my chest to say, is that we're all interested in the women and girls of the continent. We're interested in ensuring that, I mean, sometimes when we discuss, we must focus on the commonalities, what brings us together, what binds us. I mean, that's my approach towards my advocacy. We look at the things that bind us. We're all interested in progress, in ensuring that women and girls enjoy their sexual reproductive health rights, irrespective of age, whether you are a young girl, an adolescent, or elderly person. Then once we have that, then we recognize that, and we must trust in our systems. Because if we do not trust our systems, who will we trust? And it's never one size fits all. It's not my way or the highway. I think that's the most important thing.
Thank you.
Let us focus on the commonalities, what brings us together, what binds us, and what our interest is. And that's the women and girls of the continent. So the work we do is for the women and girls of the continent, whether we're at the global level or at the regional level. And we collaborate, because our mandate is to collaborate with member states and to guide them and to ensure that those member states are able to put in place the progressive principles, policies, and law. And at the African Commission, this we do through our state reporting process.
I'm sorry, Honorable, I'm having to stop you.
But I think it's very important, and I want to thank you all once more, sorry, for taking time, because you asked me to share reflections, and I was about to do it, but then you didn't hear me. So I just wanted to just respond to say, and this is the way to go, to be forward-looking.
We are grateful for that. Thank you.
Yeah,
thank you so much.
Thank you very much. Thank you.
Thank you, Honorable Janet, Honorable Brenda, and Madam Ndashe. Thank you so much. Please, let's give them a warm round of applause. I'm so sorry for keeping you longer. Forgive me. Thank you.
Thank you, Ishianisu. We are running behind time. We would have wanted to continue with the discussions, but we're supposed to leave for lunch, and lunch is being served at the restaurant just behind this hall. And if you look at your name tags, you have this at the back of your name tags. Those are your meal tickets for this Baraza. I hope you had them. If somehow you lost them, you'll have to see our organizers, but I hope and pray that you still have them. Please, let's go for our lunch. We have exactly 1 hour. It was supposed to be 1 hour, 30 minutes, but if you're back in the next hour, we'll be able to catch up with our time and our program. Thank you. Bon appetit.
This needs to be on because they pick.
Afternoon, ladies and gentlemen, and welcome back. I know it's difficult to have people sitting down after lunch, but I'm calling all those who are close by who can hear my voice to start walking back to your chairs, to your seats, so that we can proceed with the program for the day. And maybe just a housekeeping announcement. Kindly note that the mics on your tables are functional, and if you want to make a contribution, you don't necessarily have to wait for the mic. If you just press the blue button, you can start speaking. Obviously, with the permission of the person chairing. Ladies and gentlemen, allow me to welcome to the podium Bashe, who's also named Tatiana Natalie Kondo. She's a Zimbabwean writer, poet, and a cultural curator. She's the originator of the Afri alternative hip hop and the founder of the womanist movement, She and the Battle Scars and Healing Platform. For almost a decade, she has used art to heal and defend human rights, carrying the Zimbabwean voice across Africa and Europe. And she is a Zim Hip Hop Award winner and House of Hunger Poetry Slam champion. So, ladies and gentlemen, with a round of applause, let's welcome Bashe.
Good afternoon, ladies and gentlemen. I hope you're all doing well. As previously alluded to, my name is Tatiana Natalie Kondo, but you can call me Banshee. I am a spoken word and hip hop artist, as well as a cultural curator, and it is such an honor to be standing before you today. But before I begin, I'd like us to do something together. I need you to trust me for a few seconds. May you kindly close your eyes. Forget everything. Forget who you are and become. Imagine you're in a clinic, you're sitting at the receptionist's desk, and a 16-year-old girl approaches you with questions about her body. She's bearing these questions. She's coming from a home without a guardian. It is just you, her, and her God. Are you going to help her, or are you going to send her away? Sit with that for a minute. You can now open your eyes. This is the law that we're existing under. This is Section 76. You call it protection, whilst we call it a cage. How you lock up her rights behind a boundary of age. The big, bad bully sits at the receptionist table at the sex ed office with big, red lips that hide a prejudiced tongue. Section 76, this tongue is a sword that steps back facts and futures, leaving sutures and the same question papers that young people submit. Blank spaces in desperate need of filling, like being too young to qualify for healing. Questions like, how is this body supposed to function? Why are my dreams often wet? Will my needs ever be met, or should I only ever bet on bigger bodies? Tell me, how can anybody Remain steady when forced to carry the weight of the world in a premature uterus. Isn't prevention better than cure? And is having bodily autonomy demure? Do I need to not matter in order to matter? And shouldn't policies read better? You see, culture will say speak. Speak in silence. Don't be too loud. Don't be too loud and proud. Cower at the thought of CONTRACEPTION contraception. Wait for apparent CONSENT consent. No matter how difficult the situation can get, no matter how difficult the situation already is, because everyone seems to have a say on hers and his rights to dignity. Section 51. You see, sometimes I wonder if this battle over bodies will ever be won, if there is no morale in the big, bad bullies' definition of morality. How many of you have ever been afraid? It's okay, I'll wait. All right. How many of you have ever been afraid to ask the difficult questions? You see, there is no morality in the big, bad bullies' definition of it. How many of you are vowing to do better? Wonderful. Thank you so much.
Another round of applause for Banshi. Thank you so much for using the artistic voice to raise questions and things that we're supposed to respond to, but sometimes are afraid to speak to. At this point, allow me to introduce the other panel for the afternoon. And the moderator for this panel is a doctor that we have heard from before. She gave us the keynote address. And the way she spoke to us, she made us understand that if you're passionate about something, your profession doesn't limit you. And as a medical doctor, she gave us how we can use the law to make sure we protect sexual, reproductive health and rights of children and of minors. Help me welcome Dr. Kathleen on the platform. Thank you.
Good afternoon again. I've got the difficult shift, the one after lunch. But we promise that this will be a great time for all of us. And I just want to acknowledge the poetry and that performance that we've just received. Thank you very much, Banshi, for that poem. That reminds us really that resistance is never just an abstract. It lives within us. It is in our choices, in our bodies, and it is something that we must insist on having to really keep the advocacy and the activism forward to ensure that all of our humanity is seen and recognized at every age and at every level. And this morning, of course, it wasn't too long ago, so I don't have to remind you about everything I spoke about, but it was important to name the ways in which legal systems across the continent use age, both youth and advanced age, as a mechanism of exclusion, and how we can actually, and how we think and process and define our collective efforts, we can put in the center dignity through bodily autonomy, through information and care. And absolutely that as we move throughout the next few days, I implore all of us to center this idea of dignity through everything that we do. And so this afternoon, we move from the diagnosis. Being a doctor, I'll do the nerdy thing about diagnosis. And now we move to strategy. And it's important that we don't only just diagnose the problem. I think all of us in this room are really good at that. we have to name, from just naming the structures of exclusion to asking what are the actual instruments we already possess as Africans within our own normative systems to dismantle all of the different ways that seek to take away our rights. And because here is the truth, we do not lack the law or the legal frameworks. The Maputo Protocol, for example, in Article 14 guarantees the right to sexual and reproductive health. The African Charter on the Rights and Welfare of the Child in Article 28 addresses the right to health. And the African Charter on Human and People's Rights guarantees dignity and non-discrimination, as well as the right to health. And so the instruments exist. The question is whether we are deploying them with the ambition that they demand. And so I have assembled a panel of people who do not merely just interpret the laws or these instruments. They shape them, they apply them, and they litigate them. And they live them, and of course, within their consequences as well. And so I want to introduce them briefly. And as I introduce each panelist, please join me on stage and take your seat. First is Justice Eva Luswata Kauma, who sits on Uganda's Court of Appeal and Constitutional Court after 2 decades of legal practice. She holds a master's in human rights and democratization from the University of Pretoria and a postgraduate diploma in women's law from the University of Zimbabwe. Her contribution to reproductive justice is most sharply reflected in her dissent in the consolidated petitions challenging Uganda's abortion laws, where she affirmed that the Constitution creates space for lawful termination of pregnancy and recognizes the continuing relevance of the Maputo Protocol's reproductive health protections, notwithstanding Uganda's own reservation to Article 14.2c. Thank you very much. And next on the panel, I would like to call Justice John Abiakotonda, who is a judge of the High Court of Rwanda and first vice president of the Rwanda Judicial Officers Association. His substantial experience in criminal adjudication places him at the intersection of age, consent, and bodily autonomy, the very questions that arise in cases of sexual violence, child sexual abuse, and early or forced marriage. He brings both a courtroom and institutional perspective on how courts can protect children from harm without reducing adolescents to passive subjects or erasing their dignity and evolving capacities. And next, I'd like to call Associate Professor Robert Doya Nanima, a Ugandan children's rights scholar and head of the Department of Criminal Justice and Procedure at the University of the Western Cape. He's a member of the African Committee on Experts on the Right and Welfare of the Child, serving as Special Rapporteur on Children in Conflict Situations and chairing the working group on the implementation of decisions before academia. He spent 9 years as a prosecutor in Uganda's Directorate of Public Prosecutions, and he brings a critical regional perspective on the intersectional nature between child protection and adolescent autonomy, dignity, and access to health and remedies. And next, I would like to call in Lloyd Kuvea, who's a human rights lawyer who previously served as Associate Director at the Center for Human Rights at the University of Pretoria, coordinating the Master's Program on Sexual and Reproductive Rights in Africa. He has extensive experience engaging the African human rights system and will situate age-related SRHR claims within regional accountability mechanisms, drawing practical lessons from strategic litigation and advisory proceedings before continental institutions. And last but not least, Catherine Namulanda is an advocate of the High Court of Kenya and a program officer at Kellen's Strategic Litigation Unit. Grounded in feminist principles, her work advances the right to health through strategic litigation with particular attention to adolescents' access to information, services, and reproductive autonomy. She has challenged restrictive policies, including blanket parental consent requirements, and has advocated for comprehensive sexuality education and youth-friendly services. She affirms young people as rights holders whose voices, evolving capacities, and lived realities should shape litigation and judicial decision-making. So you can agree with me that's an amazing panel that we have brought to you. And as part of this panel discussion and the conversation, just with the first round of a conversation, I would like to first start with Justice Eva to please help us understand, as you sit on the Court of Appeal in Uganda, a jurisdiction where age-based restrictions on SRHR are both legislated and deeply contested. From the bench, when a matter comes before you that involves young persons' access to reproductive health and services and information, what is the interpretive framework that you apply? And of course, does the Maputo Protocol, which Uganda ratified, feature in your reasoning, or does it remain aspirational?
Thank you very much. I thought I was going to stand, but no, it's okay. It's more comfortable actually. Yeah. Maybe you don't stand. This becomes a bit difficult. Yes, thank you very much, Mom. Good afternoon, and I've been introduced, and I'm standing on the protocol. And I bring you greetings from Uganda, especially our court and the judiciary of Uganda. It's an interesting question, but maybe as a way of introduction, matters of health rights in Uganda, especially interrogating health rights as a constitutional right, whether it is for youth or old people, whether it's an age question, is relatively new. And why is that? It is because, for some inexplicable reason, health was not considered in the bill. It was not added to the Bill of Rights of Uganda. So, and then we also had the problem of political doctrine. So most of the cases that were coming before the Constitutional Court were being thrown out for that reason, the political doctrine, that these are matters that the courts should not engage in. But eventually we can say that is now below the bridge. And there's been a lot of judicial activism in the area of those rights. And I'm sorry, somebody has been trying to ring me the whole day. So maybe you could ask your question again. And then.
The question was, how do you use the Maputo Protocol? And the different
yes.
Ways in which people need to access services?
Yes, because once these rights came to the fore, our court has actually actively used international law and regional instruments in interpreting these rights. And the Maputo Protocol has in it, I think you've mentioned the articles, Article 14, and then there is the Banjul as well, which talks about protection against discrimination, irrespective of age. The Children's Statute, the Children Convention itself does that. So one good way of doing it, which I have done before in some of the petitions I've handled, is trying to not to stick to just one. It is trying to lump as much as possible what you can get from the different instruments, not just Maputo. And of course, you're not going to do it foolhardy. You're going to be very systematic. You're going to look for that thread. Where is that thread? And why do we do that? We do that because of the reservations. There has been a reservation, as you know, by Uganda and many of the other African countries to Article 14 of Maputo. So one way you're going to frustrate, if I may use that word, is to lump the different conventions together. And when you find the thread, then you'll be able to substantiate your reasoning. Things like progressive realization, because even if it's going to be social and economic rights, which is health rights, they are not very clear. They are not very clear in the Banjul instrument, but there's some mention of it in Maputo. I would not hesitate then to go beyond the regional instruments and transit to the international law. where it is very clear how you can make some of these, how you can order the remedies. And we have done that before and quite successfully. Thank you so much. And next, I'd like to hear from Justice Biakotonda from the perspective and experiences of Rwanda. On paper, of course, Rwanda is often described as progressive, and in practice, through your bench and your work, how then do you describe the issues around age-based exclusions? And a lot of the issues, of course, involve access to care, like safe abortion for adolescents, contraception, even treatment of older persons. And so from your perspective in Rwanda, how do these issues manifest in your practice?
Okay, thank you very much. I thank first the moderator, the friends here, the panelists, guests, and all protocol observed. Thank you for the question. When I was coming for this conference, I met a friend and asked me why I'm coming for this conference, but he told me whether I'm not going to be manipulated by the human rights activists. And I told him that, allow me to tell you what I told him. Exactly, I told him what we are doing, best in case we come across these matters. I told him that that the world is changing, and even the judges need to change because there are new realities, scientific development, and evolving understanding human rights continue to present new legal questions. Learning about human rights, so I explained to him the role of the judge as not to choose between culture and development, but to balance competing rights and interests according with the Constitution and apply legal principles when question arises about age-based restrictions. I also, so I'm explaining, even with also your question, I also explained to him how the court must ask whether those restrictions genuinely protect people, especially children, or whether they create a necessary barrier to right granted by the law. I also further explained to him that judgments are not mere decisions that resolve disputes between parties. They are also instruments through which courts communicate constitutional values and give practical meaning of human rights commitment through the interpretation and application of rights. Courts also can contribute to dismantling and justify the age-based barriers and advancing a culture of dignity, equality, and access to justice. Also from the age is more than the number, and it is often legal category that influence questions of capacity, consent, protection. So I continue to explain to him that we need also as judges to know that when we are applying laws, we need also to think about understanding necessary performance of their constitutional laws, and even using these legal instruments to help us to interpret well the cases in front of us, and also to know that when we are handling these matters, we are not taken by policies. We are not, because we are not policymakers. We have also to think about what stipulated by the law, what is stipulated by international instruments. And I told him to be comfortable that as a judge, we handle matters, and also we have to settle matters most on the age-based, as the themes said. Not only we have to protect, but also remembering that all people needs human rights, respecting their dignity, equality, etc. Thank you.
And to you, Prof. Nanima, of course you are on the Committee of Experts on the Rights of and the Welfare of the Child, and being in that committee, we want to utilize your insights specifically because of that, and because the committee is currently drafting a general comment on Article 28, which is the healthcare. This Baraza will contribute a submission, of course, to that process. And so from your perspective, perhaps you can tell us how the committee understands the concept of evolving capacities, so to speak, in relation to SRHR, and are there any tensions that are emerging between child protection and adolescent autonomy, and how does the committee perhaps think about resolving some of those tensions if they exist?
Thank you very much. A very good afternoon. I hope you had a sumptuous lunch. And I hope you're still awake. There's a danger of sleeping in the afternoon. But having warned you about the danger, please let's stay awake for the next few minutes. I'll answer the question by starting with a cycle that I think is very instructive, and then speaking to a pattern that I think we should be able to appreciate. Then I'll answer the question. One, in terms of the cycle, it's true, the concept of age is used for various aspects. If you're going to get a driving permit, they'll look at your age. If you're getting contraceptives, they look at your age. Aspects to do with criminal liability, they'll look at your age. If you are aspects to do with child marriage, they look at your age. Even scholars who are writing about decoloniality, they are now looking at other aspects, such as perhaps we should change these definitions: child marriage to children who are being exploited, child labor to children who are being exploited. So the concept of age cannot be understated or overstated in terms of what it can do. But I hope that from this conversation, we are able to arrive at the point where we say it cannot be the only proxy to use, but rather we should use it in consonance with other aspects that we speak to. When you use age alone and it's used uniformly, it creates polarities. Polarities in the context that, yes, it's applied uniformly, which leads to exclusion as a cycle. Because when it's being applied, you don't look at other aspects that affect the specific child. Is this child vulnerable? Is this child affected by disability? Is this child affected by armed conflict? Is this child an adolescent? Is this child heading a household? So there are various other components other than age that have to be placed into consideration. So where we start applying it uniformly, it becomes an administrative issue. It becomes an institutional issue. It becomes a matter that we use at the same time, leading to an aspect of exclusion. So I think I agree with all the previous speakers that we cannot only look at age as a proxy, but rather different other perspectives. Now, in answering the question, there is a cycle that I think, from my perspective, the committee has gone through, and that cycle presents a problem and a solution. But it's not only a preserve of the committee. I should say that we have a problem. And as humanity, we are part of that problem. But I hope that I can also be comfortable to say that we have a solution, and as part of humanity, we are presenting a solution. The first problem starts with the Charter. The Charter does not have the word sexual and reproductive health and rights. It does not have the word reproductive rights. The only two times it uses the word sexual, it refers to a person who is sexually exploited of aspects of sexual trauma. So that's a problem. If you are looking at a state that is going to implement uniformly, it's a problem. Because you're implementing uniformly, but in doing so, you're excluding the persons who should be benefiting because you're not understanding what they are going through from the perspective of only engaging the exclusions. So if the cycle presents a problem, what are we doing as a committee to present a solution? I believe the solution involves part of the conversation that we had this morning. Are we going to have a charter that has all kinds of provisions? Or are we going to find a way of reading into? The committee, we have a specific article, Article 46, that allows us to draw inspiration from various sources. Sources with regard to tradition, sources with regard to human rights, with regard to humanitarian law. If there are instruments, those are instruments that have been ratified by states in Africa or ratified or human rights bodies by the United Nations. So what we do, because we realize that we don't have the specific wording, we have created inroads that are important in a way enveloping or engulfing the problem. And answering the question, we read the concept of sexual and reproductive health and rights into other rights. We don't look at it as only the perspective of health, the perspective of education. For instance, the recent Tanzanian decisions case, we use the right to education to ensure that there's promotion of sexual and reproductive health and girls. There's been a recent decision against Malawi where there is a call for ensuring that there is implementation of the findings with regard to ensuring that where there's been violation, there should be remedies, there should be accountability, there should be some kind of prosecution. Where we receive state party reports, for instance, from Nigeria, the conversation has been, should ensure that you have laws that allow teenagers to obtain contraceptives without necessarily seeking parental consent. We have also Agenda 2040, that is a sub-agenda of Agenda 2063. It draws on Aspiration 6 and 7, which believes that for us to have an Africa which is fit, whose development is informed by its children, its women, it's important that the child is at the center. And the conversation that I leave with you, until we place the child at the center, this child who needs to enjoy sexual and reproductive health and rights, and look at what specific support this child is supposed to receive. And we give that support from not only an objective but subjective position, we shall not be doing our best. But when we do that, then we shall know, yes, this is what we are doing as Afya na Haki, this is what we are doing as universities, this is what we are doing as civil society organizations. We are contributing to the conversation, but most importantly, using an optimal use of resources. In doing so, we shall have a better conversation that goes beyond. One last element, in terms of the expansive interpretation, we have specific general comments that embrace the aspect of sexual and reproductive health and rights, such as General Comment 5, which requires that aspects to do with consent should be regulated by the law other than third parties. In some instances, you need to get parental consent to undergo a procedure, and if you're not getting that consent, you will not have the procedure. We have general comments that speak to the environments of the specific children or the specific girls who need sexual and reproductive health and rights. For instance, the general comment on Article 22 on children affected by armed conflict. It requires that even in spaces where there is not only armed conflict, but there is tension and strife, these girls should get specific services that are instructive that for their health. We have spoken about the joint general comments by the African Commission, aspects to do with male genital mutilation. All those are different ways in which the African Committee of Experts on the Rights and Welfare of the Child goes beyond the missing text to read into by engaging activities, engaging state parties in areas that could be very instructive. Thank you very much.
Thank you very much. Thank you. And I just want to focus my next question to Catherine as we speak about strategy and litigation in these very important matters. And of course, you being with Kellen at the moment, you have been at the forefront of strategic litigation on health rights in East Africa. And so when you bring a case that challenges age-based barriers to sexual and reproductive health rights, whether it's concerning adolescent access to contraception or exclusion of older persons from reproductive health programming, what legal arguments have proven to work? And if there are gaps in the jurisprudence that we as a movement still need to fill, what are some of those gaps?
Okay, thank you. So I'd like to start with a couple of 3 statistics that we currently have in Kenya. One is the fact that when you look at the year 2025, there's been an increase in teenage pregnancy for children between the age of 9 years up to 19 years, rising from what we had last year. We had 224. Currently, we have around 235. And the fact that statistics point that there is a specific 14.6 increase in teenage pregnancy among young girls aged between the age of 10 to 14. Another thing to note that is currently we had a situation where a 13-year-old boy who is currently in grade 9 was a suspect where 2 children between the age of 4 years and 5 years had been defiled and murdered. And we have a 13-year-old boy as a suspect. And then when it comes to the jurisprudence in Kenya that we have around adolescent access to SRHR, we have 3 particular cases that have shaped the current landscape that we have. Unfortunately for us in Kenya, it is a legal requirement that adolescents cannot access social reproductive health care services and information without parental consent. So it's already a ban that we have in the law that when it comes to particular social reproductive health care services, an adolescent, anyone below the age of 18 years cannot be able to access that without parental consent. If there is no consent of the parent, then the next person is to seek the consent of the guardian. If you don't have the consent of the guardian, then the next person to seek is the consent of the children officer. And this has not been expounded to have a justification on why for other healthcare services, there is no form of restriction on how you have third-party restriction, but why specifically do we have it coded in our law that for anyone below the age of 18 years, you have to have parental consent. Another thing is that we kind of have conflicting information or laws when you have to social reproductive health care services. In particular, there's been a lot of progressive movement or progressive information when it comes to HIV programming. When you look at our HIV Prevention and Control Act, it actually allows any minor who is below the age of 15 years, if you present yourself to a healthcare facilities and the healthcare provider is able to assess you and number 1, determine that number 1, you are engaging in sex, number 2, you are at risk of contracting HIV, or you're already a parent, then you can easily be able to access HIV prevention tools. You can also be able to access HIV testing. But we are seeing that when it comes to one particular aspect of SRHR services, minors can be able to access them. When it comes to things like contraceptives, minors are not be able to access without parental consent. So in 2022, Kellen was able to file a petition before a high court, and the petition was challenging our national reproductive health care policy that was supposed to govern access to reproductive health care services for all women in the reproductive age, governing from the period 2022 up to the period 2032. Part of what we were challenging in the policy was the aspect of public participation and entirety, and then the other aspect we were challenging in the policy was an aspect that the policy sought to rewrite the legal requirement that we have around abortion. Number 3 was that the policy also had an express provision that reinforced adolescents to be able to access adolescents to seek parental consent before seeking reproductive health care policy. and we were not able to succeed in court on the aspect of adolescents being able to access reproductive health care policy without parental consent, because the court made an argument to us that access to reproductive health care services with parental consent is not a policy requirement in Kenya, it's a legal requirement. So it's like court telling you there's a reason why, apart from any other form of healthcare service, when it comes to reproductive healthcare service, you have to seek parental consent. So we were able to fail on that front, with the court telling us this is not a policy requirement that you're coming to challenge in law, in court. It's already a legal requirement codified within Children Acts. It's not something that you can come and challenge before court. And part of the argument that we are making before court is, one, you cannot have a blanket requirement on parental consent for adolescents when you don't take into account the evolving capacity of minors, which we know is not a foreign agenda. It's coded within the different treaties that we have in Kenya and even in Africa. How do you take into account the various capacities of adolescents? What happens to an adolescent who is already a parent? What happens to them when they present themselves to healthcare facilities and you're telling them, go back and get the consent from your parent? What happens to adolescents who are living in the streets? What happens to adolescents who are coming from abusive homes? Noting the fact that in Kenya we have high rate of instances of defilement and incest that are coming, that results from pregnancy, that it comes from adolescents. The other progressive judgment that we have in Kenya was the recent judgment that we got from our High Court. The judgment came out in May 20th of May this year, and the petition was challenging the criminalization of consensual and coercive sex between adolescents. So as part of in our Sexual Offences Act in Kenya, anyone below the age of 18 cannot consent to sex. The law does not envision anyone below the age of 18 having sex. So whether you are between the ages of, if two minors between the ages of 14 and 15, the law doesn't envision you having any knowledge or participating in sex. But we know the pregnancy statistics that we have in Kenya differ from that. So it was a petition filed before our High Court, and what was the fact that the petition was asking the court that there's a continued criminalization of consensual sex between adolescents. What happens if it's a minor, the boy is age 15, the girl is aged 14, and they are caught having sex? Obviously, the boy will be taken to the police station, they'll be charged with the offense of defilement. And the court agreed with the petitioners that the current criminalization that we have around adolescents engaging in sex was indeed a violation of their right to health within our constitution, their right to privacy, the rights of the child, and the right to freedom from discrimination. The court went further to require the state organs, that will be the Ministry of Health, the Ministry in charge of children, to go ahead and create programs that will ensure that adolescents are able to access information on their social reproductive health and rights. And then the other case that is going to shape around what we have around adolescents is currently a case that has been filed that seeks to ban adolescents from having access to contraceptives, meaning that whether we get a negative judgment from the court will ensure that we now have a nationwide ban in Kenya that will ensure that adolescents are not able to access reproductive health care services, especially contraceptives, without parental consent. Part of the arguments that we try to demonstrate to the court, number one, is the national statistics that we have around unintended teenage pregnancies and trying to reinforce the aspect of the best interest of the child. So what happens to when it comes to the best interest of the child, when it comes to the reproductive health care services? Why do we look the other way and have an aspect of third-party requirement when it comes to these reproductive health care services? Then why do we forego the best interest of the child? The other arguments that we tried to make to the court was in the issue of evolving capacity, that where we are right now and with the kind of information that adolescents have access currently, then how do we codify information and laws to them that will ensure that, number one, when we are putting aspects into law that would ensure that, number one, we are able to take the evolving capacity of the minors and ensure that at every aspect of implementation, we put in the best interest of the child, so that you're demonstrating to the court when it comes to the best interest of the child, when it comes to sexual reproductive health and rights, which have general comments at when we look at the conventions of the rights of the child, this is what the state should be doing. So there's enough laws on that, but the issues of implementation, and you also have the aspect of the anti-rights coming in and they're reinforcing the aspect of parental rights, that we cannot, when you remove the requirement of parental consent, and then you are bringing in the aspect of taking away the parental rights, that parents won't have information or won't have control in ensuring that their children are not able to access sexual reproductive health information, or coming in with the argument that we are encouraging our children to engage in sex. But at the same time, when you look at the kind of statistics that we have, when you look at the news, you're being told that in Kenya we currently have high HIV infections among children between the age of 19. So our numbers tell us a different story as opposed to what our legislator and the judiciary look at. So that is the kind of situation that we are currently dealing with in Kenya. Thank you.
Thank you very much. And Lloyd, I'm coming to you with the question. You've worked across the continent on human rights architecture, and I want to ask you, when we talk about deploying the Maputo Protocol, the Banjul Charter, and of course the ACRWC, there is a counter movement that we know of, right, that exists, the family sovereignty and values people. They seek to obviously roll back these very hard-won gains, but precisely the gains that these instruments themselves present. So how do we litigate age-based SRHR exclusions in a political environment where some of the member states are actively seeking to roll back and have a narrow normative space in their region, but also in their countries?
Thank you very much for that question. So I think the question that you're asking me here is a question of strategy. What strategies can we use to ensure that we push back against the rolling back of the gains that we have? Let me start with addressing the issue of what people term political will. Most of the times we say the reason why we are not having implementation and enforcement of all these positive normative standards that we have, like the African Charter and the Maputo Protocol, is because of lack of political will. And I think for us to resign ourselves to that, it is in itself a tragedy. And that's when you then find some of these documents that are coming up, like this African Charter on family values and so on and so forth, which are predominantly being driven by the political leaders, whose human rights understanding in so many ways can actually be very limited. And so I think for me, the starting point is to do advocacy and engage the political leaders on these issues and ensure that whatever decision they are making, whatever decisions they are making, or whatever instructions they are giving to the human rights mechanisms by way of influence and interference will not happen. Because if we resign ourselves and do not engage the political leaders, then we will have failed. So what strategies can we use to build this political will at a continental level? So when you look at the African Charter, in Article 62, it talks about the state reporting procedure. And also, when you look at the Maputo Protocol under Article 26, it also talks about the same state reporting procedures. So when you are reporting to the African Commission every 2 years, every state has an obligation to report on the measures that it has taken to ensure that the rights that are contained in the African Charter being complied with by the state. And the same applies with the Maputo Protocol. When the state is submitting its state report to the commission, Part B of that state report must look at provisions of the Maputo Protocol. What have you as a government done to ensure that the provisions in the Maputo Protocol have been complied with? What I like about both processes is that civil society, academic institutions and think tanks have an opportunity to also file their own alternative report to the commission for consideration. And now after the commission has looked at those state reports, they come up with their concluding observations and recommendations regarding what has happened. So now, when the recommendations have come from the commission, civil society once again and the activists have an opportunity to ensure that there is implementation by the state at the domestic level. So in other words, you are countering any possibility of regression by looking at the positive normative standards that are in the Maputo Protocol and the African Charter. And you are holding the states accountable in terms of ensuring that this happens. And furthermore, in terms of when there's a litigation that is going on at the domestic level, there must also be advocacy, centering on the particular issue that is being debated in the courts. And I think for me, one of the strategies that really works, there's nothing problematic about inviting the special rapporteur on women's rights. If, let's say, if you have a case like, for instance, here in Zimbabwe, the case that we are talking about is about access to contraceptives. Invite the special rapporteur before the Constitutional Court adjudicates on that case, to have a conference here in Zimbabwe, invite some judicial officers, invite some law officers, and ensure that they are, sensitized on the normative standards that are progressive, so that they do not fall prey to all the negative things that we're already seeing. And then, of course, I think for me, one of the things that you need to do, and I liked Bongile's call to action. One of the things that as civil society organizations we have done is to actually approach a number of countries who are considering some of these charters that are coming to say, look, do not ratify this particular negative charter because of ABCD. But what it also needs is you need to do your research. It's not easy to just approach policymakers without adequate research, because they'll always shoot down your arguments based on backward issues like public morality, issues of culture, public security, and so on and so forth. And you can see, even when you look at the decision that we are talking about, the LRF decision versus Minister of Health, you can see the way in which the judge got entangled in the issues of public morality and issues of needing to protect children, without also looking at aspects of self-protection by the children themselves. So you as lawyers, as activists, we need to be able to do, because I saw what the judge did there when she was now doing the limitation of rights analysis. And that's where things can get wrong. So if you are a lawyer now, you are presenting your arguments, or you are an activist, you are presenting your arguments to a policymaker, you've got to be able to balance the issue of rights in the context of issues of morality, religion, and culture, and say that the rights of children, the rights of girls, the rights of women are paramount. They should not be trumped by religious practices or cultural practices that are negative and that are backward. Thank you.
And perhaps a bit more philosophical, maybe a bit of a provocation. This morning we've heard several interventions from various speakers speaking about the fact that age-based barriers are not neutral. They are gendered, they are racialized, they are classed, and are deeply colonial in their origin. And so to the whole panel, you can take a bite in how you answer this. The age of consent and the age of majority and the framing of childhood. In terms of categorization, these are inherited from colonial legal systems and have been imposed historically on African communities and realities. And so the question is this: can we truly dismantle age-based SRHR exclusions using these very instruments and categories that themselves are the product of the same colonial legal tradition? Or do we then, on the one hand, move forward and be brave to imagine and reimagine radically what autonomy, capacity, and rights look like when they are grounded in African philosophies of personhood? So again, maybe philosophical, but what is this that's required for us to move from these current challenges forward as an Africa continent that leads, inspires, and can create its own normative frameworks and legal frameworks? So any one of you can take the first answer, and then just help me with the mic to come this way. And I just want to say to the room that you are not just traditional listeners, you are equally participating in this conversation. So I will be opening the floor after my last round of questions to the panelists. So again, that first question I think is quite appropriate for us to start simmering and thinking about. And of course, all of your other inputs will be equally important as well. Just to say that there will be a moment when I transition to all of you to give you space as well. Over to you.
Okay,
Justice.
thank you. It is a very good question. I think, first of all, as us in courts, what we need to first think about is perception. Perception, and even people need to be educated and even know these rights, and also try to not to be, I agree that judges have to observe the laws, but judges also interpret laws. And within the interpretation of laws, it is where the judge should find the loom. Because if you are interpreting the laws, when you read all these instruments, I think there is a presenter who asked us, have you ever read certain instrument? Very few people raised up their hands. I think within these instruments, there are answers to the issues that raised by the parties. For example, there is a case taken in Kenya where the two minors, one was a boy, I think, another one was a girl, where most of the time, because of the law stipulate that when there is a sex intercourse with a girl or what is, most of the people use it to punish the boy, but they forget, they just read the law and punish. They forget to read the law carefully and interpret it well. I remember in 2008, it is where I think I decided the case where I said that if there is a consent with the major people, the grown-up people, and then if there is sexual intercourse with younger people, why do we punish them? Because one was a minor. In case both are minors, let's not punish them. And I think it's the same thing that even the Kenyan part observed. What I am saying is that though they are colonial laws, even most of us, we are still taken by those colonial laws. But even though the laws are there, the judges are the one to interpret these laws and are also the one to direct the truth of what it should be given. But the most important thing, I have been talking with Professor Mulumba, telling him that I see you mobilizing, teaching, trying to tell people, but sometimes we forget judges. And the judges are the one whom need to interpret this and set precedents, but sometimes are forgotten. And even the way of approaching them is somehow difficult because sometimes they fear to come in these conferences to protect their independence and the impartiality, because sometimes can be taken, but should be approached and be, they go with the development and the change of the world. They know what should be done. They know how to interpret, etc. So that is the position of the court. Thank you.
Yes, thank you. I'm afraid I seem to have, I agree with him to some extent. My fear about this discussion about Afrocentrism, is that what you were trying to say? Can we have our own journey of laws, of international, of regional laws that is not so much grounded in what we are saying is coming from the colonial past? My fear, and I think Simbongile raised it, is that we are going to have regression. If we keep saying, let us Africanize, you know the problem of Africanizing most things. We are going to digress back into culture. We are going to be overtaken by these things that we have so much tried to run away from and progress. In my opinion, I think the current instruments put together, rounded up with the international instruments, we have sufficient safeguards. We probably need, at least from the point of view of the bench, because us at the bench, we cannot really go out and we can sensitize like I'm doing here, but we are restricted. We are arbitrators. And we are the ones who make the decisions. I think we have sufficient material in the existing instruments. We just need a mindset at the bench. As we were writing, for example, I might just give an example, and it has been raised before, the interference of, and I don't think it has been given so far sufficient attention, issues of morality, religion, culture. We are just human beings. There has been a lot of training for the judiciary. I can assure you, nobody sitting at the bench now in Uganda will say they have not heard about these instruments, okay? But we still have our own pasts, okay? So, as you are writing this judgment, and some of you are judicial officers, you're going to be grappling with these elephants in the room that are directing you where you know you shouldn't go. So if we now talk about Africanizing our instruments, my fear is we are going to go down an alley we don't want to go down to. That's my personal opinion.
I would like to be the bridge between the two. I'll be careful with my words, not to disagree, to be the bridge between the two. Perhaps we should reconfigure the concept of decolonization. Perhaps we should re-understand or revise or redefine the concept of Africanization. Why I'm saying so, the university that I teach, they have what they call pillars, and they have a pillar of decolonization and a pillar of Africanization, and there's a way they explain it. Allow me to use that explanation. Perhaps this would give us a bridge. Decolonization, from the perspective that we understand this concept was handed down from our colonial masters, it's not helping us. The biggest problem, in my view, that decolonization brings is that it brings aspects of terminologies which create their own stigma, which lead to different understandings. For instance, in the Africa Children's Charter, we have child marriage. We have those concepts: child marriage, child labor, child marriage, child labor. But if a child is not able to contract, you cannot start talking about child marriage, because the child cannot contract to marry. The same way the child cannot contract to offer labor. So supposing we are decolonizing from the perspective that we are not calling it child marriage, but we are calling it a child in an involuntary or illegal union. We are not calling it child labor, but we are calling it a child being exploited or exploitation of a child. Would that help? Then from my other philosophical heart, the university says, let's not end at decolonization, let's Africanize. Not from the perspective of borrowing culture and getting lost in the culture, but from the perspective of, yes, we have decolonized, but what response are we putting to the table to deal with the vacuum that we have created? For those of you who have been in politics, you know, at times it's very dangerous to have a vacuum than a person you hate in power. I will not continue that conversation. But for purposes of Africanization, yes, we have decolonized this concept, this terminology. The Africanization aspect would be how do we ensure that in promoting this child, in promoting this, the rights of this adolescent, the rights of this teenager, we place this teenager at the center. Is this teenager in a peaceful environment? Is this teenager in a place affected by armed conflict? Is this teenager in a place that is affected by climate change? Is this teenager affected by aspects of religion and other extremes? If we look at it from that perspective, we have rethought, we have not only dismantled, but we have rethought, we have reimagined the concept going forward. I think that re-explanation of the bridge helps. Thank you.
Thank you very much for that question. I wanted to say that for me, the instruments like the Maputo Protocol in the African Charter, in the African human rights system, and even the African Children's Charter, Prof, I think for me they are quite progressive. I mean, there are some weaknesses there. You know, if you like, for instance, the Maputo Protocol, the issue of the question around the lack of clarity on monogamy and polygamy and so on and so forth might be something. But, you know, on the whole, the Maputo Protocol for me is uncompromising, it's unapologetic in its provisions. And I remember when I was on the bench myself, I benefited from that because as a judicial officer, we received training from a civil society organization dealing with women's rights. And I dealt with two cases, one on abortion, one on teenage pregnancy. And I was able to protect the rights of these young girls using these African human rights instruments, you see now. So I think for me, what I would want to say is that, for instance, when you look at the Termination of Pregnancy Act, which I had to apply at that time, it was adopted in 1977. It said it's a colonial piece of legislation. And I think we need to applaud LRF and WILSA and other organizations in Zimbabwe, for instance, who are doing that research and litigation and challenging these colonial pieces of legislation using African human rights instruments that are progressive. So I think for me, that's the trajectory we need to move with. And I think we can make a lot of progress. What I fear and what Prof. Nanima is saying is you know, the concept of African values. And I think we were shivering when the AU gave instructions with the African Commission for, you know, a study on the concept of African values in the African human rights space. that is where things start getting, enmeshed in all sorts of things that will get us going backwards instead of moving forwards. So I think we just need to guard against the concept of, because I mean everybody was like, okay, what do we mean by African values? Whose values are those? Are they patriarchal values that you are trying to, to still maintain? Are you trying to push back on progressive gender issues? And so on and so forth. So I think for me that's where we need to be quite vigilant and just stick with perhaps the progressive African human rights instruments that we have, and they are quite adequate. What we are lacking a lot is the issue of enforcement. And that's why for me the Maputo Protocol talks about enacting progressive laws and also enforcing them. Thank you.
Thank you.
So as a litigant, I think I'll agree with the two speakers before me that currently what we have, especially those that are progressive, is what we can work with, because I think it shouldn't be an imagination in 2026 that you have a 9-year-old girl who is pregnant, or instances of incest that are happening, issues of child marriage that are happening. So how do we put, at all scenarios, how do we put the best interests of the child forward? How do we ensure that whatever laws that we currently have in place, how do we ensure that they're enforced? If it's access to information, how do we ensure that they're able to access age-appropriate information? How do we ensure that they're able to access this form of reproductive health care services? Because you don't go back to a situation where if you're currently in 2026 and if GM is still part of the discussion, then you kind of know where, especially when you go to the rural settlements, they are not so much progressive in what we currently have. So I think we see what we have, and we have a range of treaties that speak about the best interests of the child, that speak about the evolving capacity of the child. So how do we ensure that we are ensuring that they are implemented, and at every scenario, the best interest of the child is what is considered by anyone arguing before court, to ensure that a child is able to arrange a full spectrum of rights without having to consider that for this particular right, you have to seek a third-party consent, or you have to seek approval of another person. So how do we put the child, or the African child, at the center of everything to do with their rights?
Thank you very much to the panelists. Yeah, I've got another question for you. So maybe you can add that in the next question. But I just wanted to say, in terms of how we reimagine societies and how we want to move forward, perhaps human rights is the unifier that, and a standard that we should all hold ourselves accountable to, so that there is a framework and sort of like a blank canvas, but there must be parameters, right, to that blank canvas. And I think human rights, principles like non-discrimination, substantive equality, meaningful participation of people that these laws and frameworks impact, transparency, accountability. I think if there's a religion or a culture or a moral view, a political view, that then goes against those principles, as a default setting we should reject, so that then our imagination happens within that framework of human rights, again, with that idea of not leaving anyone behind, but also not reimagining systems that are going to perpetuate exactly the kind of, punishing people for the situations they find themselves, criminalizing homelessness, for example, criminalizing, certain aspects of just how life happens sometimes to certain people. And I think true to African philosophies such as Ubuntu, they are very expansive, very generous and gracious in how people can define and connect and build, communities together. So I think there is room, like you were saying, Prof, to really have a good in-between, where we can let go of the harmful practices that truly were also just criminalizing blackness for no other reason except that you were born black. So I think there is a lot to do, but the bridge that you've given us has been a really great example. And I think coming to Justice Biakonda and Luswata, perhaps in the spirit of being practical, what then would be, if a lawyer comes to your rooms, right, and there's a case in front of you, and they are trying to persuade you to say that the age restrictions on SRHR are obviously not good, what do you need to hear from those lawyers? What would it be an argument that persuades you to actually listen to them about how harmful the age, as a determinant of SRHR is?
Some of the things I would look at, or which have actually helped, is statistics and lived realities. And for example, in the abortion petition, and on top of that, even amicus can be very helpful. The petitioners presented to us massive evidence of what abortion meant to young girls and women and to the development of the country. And beyond, of course, because you see, you cannot fight that kind of evidence. It is there, as long as it's, of course, not conjured evidence. And also, I would love that lawyer to have some expert evidence. Expert evidence is very helpful, especially with these kinds of rights. And that helped a lot. We got affidavits of specialists, of even nurses, not just the doctors, but even front-line health service providers. And they are telling vivid stories of these women. And on top of that, we had stories of the women themselves. And that would help the judges. Even if you have not been very well schooled, you would then go a little bit further to make your own research, and we did that. We did that and were able to pick up on research in an area. So even if it's to do with age, it helps to provide a lot of statistics in this kind of litigation. Because you are going eventually to make directives against the state, okay, for progressive realization, sometimes not even progressive. You're going to ask for immediate intervention. Now, how are you going to do that without that kind of persuasion? You're going to tell the state that these are the statistics, and it's even affecting the economic growth of the country, for example. Those are the things that would move a state. So I would want the lawyers of today to be innovative in the way they present constitutional matters. It is no longer as things were done before. And please don't assume that the entire bench knows human rights. They may have, like I've said, everybody really has been exposed and studied, but that deep understanding has to be provoked by the people who bring the cases to the court. Yes.
Thank you a lot. What he just has said, in common law, when the higher court says something, the lower one cannot, it is binding. So what she has said is binding on my side. I cannot go against it. So as she said, it's true. First of all, if you judge, lawyers do a lot to courts. Because when the lawyers do not, when the lawyers are redundant, then sometimes we have also to agree with the judges. Judges handle a lot of matters, a lot. Because if the judge can handle, let me say, 20 cases per day, sometimes there are things that he can miss, other than he should have. So I also have a friend from Rwanda who is Tom, a Great Lakes Initiative Development. I thank him a lot because I have read a lot of his cases. His cases helped the court to set precedent. For example, there is a case where they raised concern about abortion. And then, with their cases, the Supreme Court managed to ask the state to deepen the health facilities to lower places. This was also very important. Even I think it was his case where the court go further to ask to differentiate between infanticide and murder. The court go further, showing that abortion or the accused who have committed infanticide should not be compared with murder, because this is very different, because there are also some circumstances, factors caused this person to kill his born child. There are reasons. Sometimes there is a lot of reasons. So the court raised that and said should separate this, and this was the reason of the well-prepared litigation. So I think lawyers do a lot to courts, and also judges also should, as Honorable Justice said, judges also need to be sensitized and be shown a lot, because they are, I think there is a case in Rwanda where I think a lady who I think committed infanticide, he was given life imprisonment. But the Supreme Court, having verified all the circumstances, because of the law, reduced the sentence to the minimum. Even I think it was beyond the minimum, because of those reasons. Because, for example, the Supreme Court showed that she was a young lady who was pregnated. The man who pregnated her left her. The home, the parents, the families, the society, he was as if he left alone. So because of all that pain, he decided to kill the born child. So the Supreme Court shown all those circumstances and then reduced the punishment beyond the minimum. But when you read I think the first instance court, you found that all these explanations were not given to the judge. But when it reached to the Supreme Court, where the accused had lawyers, they presented well. I think it was Tom's association. They presented well, and then the Supreme Court set a precedent. I think all this contribute a lot when you understand. I want also to go back to the issue of Africanization. For me, I agree that they are good things that we had. Though people sometimes they say culture, what? For example, in Rwanda, we had an issue of, they used to say that in custom, girls were not supposed to inherit property. But the Supreme Court judged on this and said the Rwandan culture have not have this way of custom. They based on the judgment decided by the king in 1950, where the king ordered the girls, the boys and the girls, to inherit, saying that all are the children. Okay? But because of the way people think, sometimes they create the way, they don't go back to their culture and see how their culture, even in Rwandan culture, they say that a woman is the heart of what? Of the family. So if somebody say is the heart, then it means that you cannot say that this person should be, are supposed to be degraded, isn't it? The child should be raised well because the future Rwandan. So if they say raised well, means what? Future Rwandan. They are the people who are going to be good wife. They are the people who are going to, which means that those are our culture. I think if we go back to our culture and analyze them well, I think you can create good laws other than the laws that are harmonized from different cultures, sometimes which are not even favorable to the country's culture. Thank you.
Thank you very much. And to Prof. Nanima and Catherine, and I want you to be as sharp as you can. We know currently that the general comment process is still open, and this Baraza is submitting, drafting a submission to that process. What should be in it? If you could guide a paragraph on behalf of us all, what would that paragraph say on SRHR and age in that general comment process?
I might not be able to give you the exact paragraph that you're requesting for, but an approach that would be helpful. From the discussion that there is the question of intersectionality. From the position of the committee, intersectionality is first about reading other rights into a specific right. Secondly, using that child rights-based approach, but embracing the lived realities of that child. The general comment itself on Article 28 is more about drug abuse. But you'll establish that most of the vices that come as a result of drug abuse lead to sexual and reproductive health and rights. I mean, most of the vices that children suffer from would lead to aspects of violation of sexual and reproductive health and rights as a result of drug abuse. So I think creating that link is something that the current special rapporteur on the right to health is envisioning. The special rapporteur on the right to education in terms of having comprehensive sexual education is envisioning. The special rapporteur on children affected by armed conflict, I'm also envisioning. So let us look at it as a combo whereby we are able to speak sexual and reproductive rights into that specific general comment. I think that would be the best way to do it. If you're looking at the lived realities of the child, you're looking at the actual backbone of the Africa Children's Charter. And the lived realities is more of a check that you'll always use to engage aspects of provisions in the Charter. If you're looking at the child rights-based approach, for instance, participation, the aspect of evolving capacities, not being linear, but looking at the cognitive, looking at the moral, looking at the ethical, it gives a lot that we can work with in the context of sexual and reproductive health and rights.
Thank you.
Thank you.
Catherine?
So I think I'll pick something that's already on the general comments on the rights of the child, comment number 4 on adolescent health and development in the context of the Conventions of the Rights of the Child. that a recognition for state parties on that they should ensure that adolescents or every child every child has access to social reproductive health care information and services, regardless of whether there's a guardian or parental consent, taking into account the evolving capacity of the child and also putting the best interest of the child at heart. I think with those three, which is what we used to make in argument before court, we are able to create an environment where we continue to put the best interest of the child when it comes to SRHR and ensure that they are able to access these services and information.
Thank you, Catherine. And Lloyd, you have the last word before I open to the floor. And it's an interesting one, I think. Which piece of strategic litigation on age-based SRHR exclusions that is not yet brought but should be brought? Which one is it? And where should that case be made?
Okay.
Simple one.
Yeah, I think besides access to contraceptives, and I'm just trying to think something that is unique that has not been litigated on. I think, for instance, the issue of consent to sexual intercourse. I think that is an area where it is very complex, and I think many different jurisdictions it looks like there's no unanimous thinking around that. And for me, I think that is one such piece of strategic litigation that will help a lot in terms of the protection that the judges are talking about, that we need to protect the children from sexual exploitation. And for me, I think the fragmented approaches by the judiciaries across the continent on this issue is highly problematic. And I think that, where would we bring that? I would love for lawyers to litigate at the highest level in their own jurisdictions, first of all. And then when we don't have the remedy that we think is progressive and best protects the children, then we have to then approach the sub-regional. In West Africa, it would be then the ECOWAS court. Of course, a lot needs to be done still, and then I think what needs to happen first also is to do training. I know some 2 years back, when I was at the center, we did training for judges of the ECOWAS court on substantive equality. And that had to be done because of some of the problematic jurisprudence that was emanating from there. So you don't say, okay, we can't use these platforms because of maybe lack of the in-depth knowledge. You still need to sensitize. The other option, obviously, because of issues of broad access, is the African Commission on the Rights and Welfare of African Commission on Human and People's Rights, because of the broad access provisions. But also, what I would also then want to approach, because Prof, at the committee, you are always talking about the lack of adequate communications being filed there. And I think for me, perhaps, filing a case at the African Committee of Experts on the Rights and Welfare of the Child in Lesotho would really go a very long way in coming up with jurisprudence that is progressive on this issue. The African Court is problematic for one reason alone, because of the very restrictive access provisions. And perhaps this is one thing that perhaps, because the court was also given the mandate to interpret and implement the Maputo Protocol. Sadly, we only have 8 states on the whole continent that have signed Article 34.6 declaration allowing direct access. So the court remains inaccessible for many, so perhaps it would not be the best. So I would propose 3 jurisdictions, the ECOWAS Court of Justice, the African Committee of Experts on the Rights and Welfare of the Child, and the African Commission on Human and People's Rights in Banjul. Thank you.
Thank you. And so in the spirit of the Baraza, we are having a very unconventional Q&A session. And here are just some 3 things I want from you. If you have a question, make it sharp and maybe say who you are directing the question to. If you have an experience to share, that's very welcome. Make it concrete. And if you have a challenge to what has already been said, bring it on, because we are not scared of challenges and discussions and talking, which is the very spirit of the Baraza. It's bringing us together, but taking us along with each other. And so I will take questions in clusters of 3. I already see a hand over here. If there's another hand around the room, maybe get up so I can see, because I've got the other stage lights. There's one there and one there. So it will be one here, one, and over here. So you may take the floor. Do you have the microphone? One question. And maybe give us your name and where you're from, and yeah, and then please provide us your intervention.
So good afternoon, everyone. My name is Anika Gray, and I'm from Jamaica. I actually have 3 questions. They're very, very short, and they're for 3 specific panelists. Is that okay, please?
Yes, but short.
Very short. So and please excuse me if I don't pronounce the names correctly. So my first question is to Justice Luzwata. And my question is, does the Ugandan constitution protect expressly the right to health? And if it does not, how do you justify using Section 14 of the Maputo Protocol to interpret the scope of the rights in that constitution? So that's my first question. The second question is to Professor Namimo. Professor Namimo, yes. My question is in relation to the concept of evolving capacities. It's a very broad concept, and it really doesn't tell you exactly what you should be looking for as a decision maker or a policy maker. What do we mean by evolving capacity? So I'm trying to get from you, if you could give us some concrete understanding of what that means in practical terms. So is there a test? Is there something that a policymaker or a judge can use to determine what we mean by evolving capacities? So that's my second question. And my final question is to Ms. Namolando. Yes, my question relates to the Kenyan Constitution. Are organizations versus individuals allowed to bring constitutional actions under the Kenyan Constitution? And if yes, what criteria do they need to satisfy in order to do that? Thank you.
Thank you. Over to you, gentlemen at the back. You can use the microphone on your desk. You can press.
Yes, thank you very much. I'm called Tom Mulisa from Rwanda. Justice John talked about the case. I think with regard to age as a determinant, we faced a challenge with the High Court applying Article 14. It was a case of a 13-year-old who needed an abortion. And as you know, Article 14, paragraph 2C, talks about the conditions of rape, forced marriage. And the court told us that the protocol talks about a woman, not a young girl. So they were asking us under which ground can a 13-year-old seek an abortion, yet the protocol, it's a protocol for women. In Africa, that was the reason, that's what the judges were telling us. Not how does a young girl of 13 years be protected, yes, by this protocol, yet it's a protocol for women. And I think this is important when we are talking about age as a determinant, because we made sure to explain to the court that the term woman as used by the protocol and going back to the preamble of the protocol would not only be restrictive to women, but also to include young girls. And I think it was included in the decision of the court. So I thought this was important to talk about when we are talking about age as a determinant. Thank you.
Thank you, Tom. And over to you, my lady.
Thank you very much. My name is Abigail from Zimbabwe Women Lawyers Association. My question is directed to Professor Robert or Lloyd, who both spoke about African mechanisms and the possibility of pursuing litigation in those spaces. And I think I speak from the disconnect that is there between national level litigation and the litigation that's going on, whether you think about the African Commission, whether you think about communications to the committee itself. There are lots of violations on the African continent, but if we juxtapose it to what these mechanisms are dealing with, there's a vast disconnect there. And perhaps the issue is it not a structural barrier that is causing this? Because yes, it's straightforward to say exhaust domestic litigation, but domestic litigation has its own barriers for you to exhaust. And by the time you want to make use of these mechanisms, you're already facing a hurdle. Shouldn't it be time perhaps to assess how do we start addressing the issues of accessibility of these mechanisms? Thank you.
You may take the
Thank you very much for the two questions. I'll start with a question from Gray from Jamaica. I expected you to start with the name Robert. I was going to say Bob Marley, but that's fine. So the concept of evolving capacities, if I was to speak about it, I would require 3 hours. I'll try to do it in 2 or 3 minutes. It's usually from the perspective, yes, we all understand there should be a degree of participation from the child, from the perspective that the child is not only participating for purposes of a checklist, but it has to be practical. I think that is where your question is. The concept of evolving capacities under the Africa Children's Charter is not greatly provided for. We use Article 46 of the Charter to say, despite the fact that this is not provided for, we shall draw on inspiration from other sources. And one of those sources that we draw inspiration is the CRC, the United Nations Covenant on the Rights of the Child, and its committee. Now, its committee has done a lot on the concept of evolving capacities, but from a substantive perspective. There's a recent report that was released by UNICEF Innocenti, a 2026 report, that gives a substantive engagement of evolving capacities. First of all, it recognizes the conversation in the room that age should not be the only proxy. Look at other aspects, because it's a capacity that is evolving. But it goes ahead to list 5 aspects of evolving capacities and later concludes and says these evolving capacities, they do not lead to a position of evolving capacities that is linear. For instance, if you're talking about cognitive growth, your intellect and other aspects, it continues up to your mid-20s. You're past being a child, but that capacity is still developing. The aspect of physical evolving capacity, very subjective. In some areas, because of the morphology of the young boy or the young girl, it's said that he or she has developed. In other areas, it might not be the same. So it's always subjected around 18 or about. If you're speaking about social evolving capacities, it's to what degree do you have a great and effective communication? To what extent do you have effective communication within the societies that you're in that will enable that to develop? In a specific society, perhaps in the Northern Hemisphere, they'll give emphasis on the right to play. When you go to a country that has armed conflict, it's not about the right to play. It's about us seeking that the guns are silenced, not by putting the silencer, but ensuring that the actual armed conflict comes to an end. If you're speaking about emotional evolving capacities, I hope we are friends after this. Gen Zs, they have a way of having their own emotional engagement. They'll work today and tomorrow they'll tell you they are tired. They cannot take it anymore. It's too much on them. So the concept of emotional, cognitive, evolving capacity, emotional capacities come to the fore. When talk about morals, it comes to aspects of ethics. So what is ethical? Is it a subjective engagement? Is it an objective engagement? So if we are to take these 5 items to deal with evolving capacities, it's very substantive, it's very resource intensive, it requires carrying out research, it requires some kind of baseline that a country, a state should be able to engage before we have conversations on evolving capacities. So from the lived reality of the African child in Karamoja, of the African child in Lilongwe, this might not work because of the barrier that requires logistics. Now, for the committee, we have done more of a procedural engagement of evolving capacities. One, yes, we have rules that speak about participation. We have rules that, when you look at our charter, we read into the aspect of evolving capacities. For instance, there should be assurance from the state that if a child has something to say, that child should say it. It's also from the perspective that it's not based on the intellect of the child, but it's based on the fact that this child feels he has something to say. And as a result of that, that child should say it. In addition, it should be practical. I'll tell you a short story. There is a child who attended a certain CSO forum at our session, before the session. He sounded so good, I was impressed. And I was told that he would make an opening speech for children at the session. But the child who spoke at the CSO forum was very different, could not recognize the same child who spoke at the session. Because when they discovered he could speak so well, he could articulate in his own way as a child, he was given ideas on what to do for purposes of that participation being meaningful. At the end of the day, it was not meaningful. Another example, we had a specific panel discussion and we required to have a child speaking, a child who had been affected by armed conflict. Unfortunately, due to travel restrictions, the children who were supposed to be part of the panel were not able to travel. The children in the room had not been affected by armed conflict. So much as we would engage the procedural aspect to have participation and tick the boxes, they did not know anything about armed conflict. So it's something that we are grappling with. The substantive aspects are very resource intensive. The procedural aspects, we try our best to ensure that the children go through a process whereby by the time they come to give their views, there's been some kind of process that has been involved. There's a time we had children in a specific country who were speaking very good English, and it was established that they were not alive to the lived realities of that specific country. When they got children from a specific part of that country, the conversation was different. So the practical aspects are really subjective. From one specific state to another state that had a national parliament, it was established that, yes, there was a lot of engagement by the children, but whatever report that they gave ended with the Speaker of Parliament, and she simply got it and put it in her drawer and closed it. So much as they participated, the aspect of consideration of what they had engaged never saw the light of day. So to answer your question, it is still something that we are dealing with. The substantive aspects, very logistical heavy, but we try at least with the procedural aspects. Practically, if it's something to do with children affected by armed conflict, let us have that specific child. If it's to do with children and climate change, let it be a child who is from that space. Otherwise, if you don't do that, you end up simply checking boxes. You end up simply having children who could be in this room and they are sleeping because they don't understand what's going on. You have children who are attending our communications and they don't understand why we are speaking big words about exhaustion of local remedies, which brings me to the next question. Is there a disconnect? First of all, we should understand that at the regional mechanisms, it's not about whether it's a criminal case or a civil case. So when you're dealing with aspects of proof, at times there's a conflation of proof beyond reasonable doubt or proof on a balance of probabilities, but it is expected that aspects to do with admission of evidence, evaluation of evidence, is greatly done at the national level. What most of these regional mechanisms are doing are to establish if there has been a human rights violation. If you're establishing the existence of a human rights violation and directing or giving recommendations on what the state should do, it's very different. But in the next 5 seconds, the aspect of exhaustion, at the committee, we don't only look at exhaustion, but we look at the exception to exhaustion. A couple of communications, we have decided it was not possible to have these specific remedies exhausted at local level, and for that result, we handle them at the committee level. Examples of Mauritania, Cameroon, and others would come to the fore. Thank you very much.
Thank you. Again, it was a question from Miss Gray, Jamaica. The answer is no. We do not have an explicit provision. But within the same constitution, we have what we would call maybe remedial articles. In our preamble, we have a part that national directives, and I can't say the full term, but they were like guidelines of how the state should administer in accordance with that constitution. And with time, there was litigation about that, because in that, there are nuances on the right to health. And the Constitutional Court said those directives were made part of the Constitution for good reason. So now those are also binding on us. Now, although we don't have it in the Bill of Rights, there is an article that says the Bill of Rights is not exhaustive. And any other, all rights that have been recognized can be subject to, are justiciable. And then, of course, like I said, there's a lot of judge-made law now. We do follow a lot of judge-made law in the realm of human rights. And they have actually said you can apply, even if you are dual, that we must have international law first legislated. We've bypassed that with judicial pronouncements that you can actually use Maputo and the other instruments. And we have successfully done that. So you may take a chance to look at our constitution, you'll see all that.
I think there was a question for Lloyd.
And I think there's also another one in the article that says where there are lacunas in this constitution, you can apply international and regional instruments. Yes.
Thank you. Lloyd, and then Catherine, you'll have the final word, and I will then move to close the session for us.
Thank you very much, Doc. Just a quick one to Abigail. I agree with you that the problem of access is real, particularly the African Court, like I said, because of the issue of Article 34.6. But, we still have access to the Commission and the committee. And also, for those in West Africa, the ECOWAS Court of Justice does not have a requirement for exhaustion of domestic remedies. The good news also for those of us in SADC, apparently, the heads of state eventually realized that when they closed the SADC tribunal in 2010, they made a gross mistake, a grave mistake. So they are now bringing it back. They are in the process of drafting the new protocol. But what I would want to urge colleagues in civil society is to participate in that process. So perhaps that you can have a provision there that promotes access to justice at the sub-regional level. Otherwise, it becomes meaningless. So yeah, I think I would say that. And then just to add that for the African Court, since access is problematic, there's also the process of filing a request for advisory opinions from the court. When you get the advisory opinion, you don't have to exhaust any remedies, any domestic remedies. You can then use that advisory opinion to do your advocacy, to change laws on the ground in your country. Thank you.
Catherine, short, sharp.
So my answer to Ms. Anika is yes, our constitution allows us to bring, to litigate on constitutional matters, in particular our Article 2 that talks about enforcement of the Bill of Rights. So it allows you as an individual to file a case either in your own interest, in the interest you being a member of any organization, or in the public interest, where most NGOs come in the aspect of public interest. So demonstrate to the court that you are filing a case not only for the interest of a particular demographic or in the interest due to the programmatic work that you do.
And thank you so much to all of you. And I just wanted to perhaps bring one last angle, and it's something that we can answer as the days go by. But the ability of governments to also support the work of human rights is important, because we know in many jurisdictions there's a lot of reprisals on individuals, NGOs and civil society and activists who work to protect and advance human rights. And I'll give you a story, but I won't tell you the country, but even in my capacity as a United Nations Special Rapporteur, I did a lot of amicus briefs supporting different court processes on the continent. And one of the state attorneys wrote back to me to say, if I ever set foot in that country, they're going to arrest me and my counsel. Hence, I can't visit that one particular country because I can't guarantee what's going to happen, despite the privileges and the immunities that come with the work, of doing the work on the behalf of Human Rights Council. So I think if that can happen to us as leaders, can you imagine then the pressure and the terror sometimes, that women and girls and activists have to deal with in their own countries. And I think, of course, the law, as it is really important as a tool to protect and advance human rights. And we began this morning by naming age as a determinant of SRHR. And this afternoon, we've taken it a step further. We've brought you judges, we've brought you litigators, and the very people whose job is to interpret our continental instruments. And that the law is not a barrier, or at least it should not be. And that the barrier is often in the failure to interpret or to use what we already have with the boldness that it demands. And it's in all of us in this room for the next couple of days, but to continue these networks. As we think about the Maputo Protocol, it does not whisper, it's very clear. Article 14 does not hedge. The ACRWC does not condition the right to health on reaching an arbitrary age of majority. These instruments are clear, they speak clearly, and our task as advocates, as activists, as judges, legal scholars, as movement builders, is to match the moment and the ambition of these instruments. And tomorrow, this Baraza continues. We will run into reclaiming this terrain. Today, we have named the terrain and identified the tools. What remains is our will, and I say, collective movement building as we move to this new Africa that we all deserve. We must build it together. It is incumbent upon all of us to do what we can in our little corners. And join me in thanking incredible panel this afternoon. Thank you very much to the panelists for gracing us with your knowledge and your insights. Greatly appreciated. And thank you for being here this afternoon. Thank you so much.
Thank you, Dr. Tlaleng and the panel, and thank you for the conversations that we have had. And as we wrap up for the day, there are things that we need to talk about, because it seems from the discussions that we have had, we are agreeing on same issues. And I'm sure one thing that we are agreeing on is age should shape protection and not restrict access. Number two, backlash hits women at every age. And the real gap is in the implementation of the existing instruments, the Maputo Protocol, the ACRWC, and not necessarily an absence of standards. And everyone shares the same goal: protecting women and girls of all ages. leading us to the divergent views being about strategy and not intent. So there was a question that I was thinking about. Are we just focusing on the women and the girls? Are we not including the boys in SRHR issues? Are we leaving them out? It's a question that I'm posing to every delegate in the room. And if there is something that you feel it's burning, that we left out, that we're supposed to discuss, this is the floor. One thing that we should keep at the back of our minds is, as we leave this Baraza, we need to have the Harare principles. And as we are concluding, we can even start now. The rapporteurs are set, they are taking note of your contributions. And the mics, you already have mics on your tables. And if you feel there's something burning that you need to contribute and that you need to let us know your thoughts, the floor is now. Thank you.
Should I?
Please proceed.
Thank you, Chair. I'm Secretary MCC from Uganda. You have pointed a little bit to it, and that's the leaving out of the boys or of the men in this age as the determinant of sexual and reproductive rights. I have known cases whereby older women have enticed younger boys below the age of 16 or 16 into sexual activity. Remember that we're talking about something that, quote, is instinctive, sexuality. There are no schools for sex. And all of us here, adults, probably have been sexually active. And you started somehow, somewhere. And that has remained a gap. So I think we need to also focus on them. Knowing that we're talking about something which is a biological instinct, just like walking or eating. It starts someday, and then it goes on. The other gap, of course, was on older people, 60 and above, who also have, of course, sexual rights, reproductive rights, and we have left them out. I've known many women above 60 who have been raped. The other thing that we also, I thought we left out is what we do most in Africa and many parts of the world, which is war-related sexual violence. We haven't really talked about it much. And who is responsible and how do you address this thing? How do you litigate it? How do you, how do you deal with these young, or women especially, who have unwanted babies from people they did not even know in the context of war? We have had this almost in every part of the continent. So to me, I think these are gaps which I don't know how to address. I have some ideas, but I would like to hear people trying to speak about them. Can we speak about mass reparations, for example? What do we do with children born of rape in war? Do we make orphanages? Orphanages African? We need a guiding principle on how to deal with these things. And I think, to me, the guiding ideology is not going to come from these instruments that I've heard people quoting, but is going back to us, African roots, and saying, what is Afrocentric? What ideology can we use to guide us into making our laws to govern these things? And that's where I go back to Winko. Thank you.
Thank you so much for that contribution. I'm sure the rapporteurs have taken note of that. And the question remains, what are we doing about the boys? And what are we doing with the women in cases of war and civil unrest? Are we talking about their rights? Are they catered for, the children, the SRHR issues in cases of conflict? Are we also going to look at them? Are we going to discuss issues around them? Any other burning questions?
This way.
Sure, you can go ahead. I'm sure you can get a mic from...
there it comes.
Okay.
Thank you. I would like to ask around the young lady who gave us a testimony. I don't know if she's still here, or perhaps somebody can find out information about her. I got interested. She was a young woman who was a fifth wife in a polygamous marriage, and she was being abused during her marriage time. I would have loved to know how old the other sister wives were, the other four. It is good information. And also to find out if she was not being abused by the other wives. Because there's a tendency of women being used to perpetuate these patriarchal habits that lead us into problems. She could have been abused by the other sister wives, but she didn't say. So yeah, it would have been good for us to learn a little more about the relationship that was happening between her and the other wives. Thank you.
Thank you for the question. Unfortunately, Chantal is not in the room, but we'll definitely make sure she gets the question and you'll get the response. Any other burning questions? I'll take 1, 2, 3, and we are done before I get fired. Thank you.
Thank you very much. I want to propose that since we've identified that there is a challenge around the boy child, we have a session perhaps in the next Baraza which focuses strictly on the boy child. I'm coming from Uganda, I'm a judge, I sit in sessions. There is a problem. There is what we call trafficking in children. What happens is that we have young girls, of course, whom we are dealing with now, who don't have jobs and they are vulnerable. They want to go and work, but they are underage. So what happens is perhaps a mother agrees with them or decides for them, since they can't decide, and takes them to go and work. Later they are tracked. And who is charged? The person now who took that person to work. And the charge is trafficking, and that's a capital offense. So there are many people in prison. The girl can't decide, but we have that challenge. Number 2, the same young girls, sometimes because of poverty, the people that live with them connive. And there are many cases where you find framed up defilement charges against young boys just because somebody wants to use this young girl to earn a living, go and testify and say, this person did this. So there are many issues around the boy child. But because the law now is so proactive, we have gender-based litigations and all this, but the focus is on the young girls. So we need a session that we can give the cases and the other scenarios. I can't bring them out here, but the young boy needs help.
Thank you so much. More for the planning for the 5th Baraza. Please, the planners, take note of the discussions and possible questions, and for the panel. Thank you.
Thank you. My name is Kenneth from Springs Public Interest Hub, Uganda. As we document the Harare principles or resolutions from this Baraza, I think it is important for us to recognize and appreciate the efforts that have been done in the SRHR in reproductive justice. I particularly want to thank and for it to be on record, want to appreciate Honorable Justice Eval Swata from Uganda, the Constitutional Court. I have appeared before her on a panel of 5 justices presenting petition 10 of 2017, that is CEHAD, Center for Health, Human Rights and Development versus Attorney General. because we have a restrictive legal regime as far as abortion is concerned, and our constitution in Article 22 Clause 2 stipulates that nobody has the right to take the life of the unborn child except in accordance with the law. Whereas our constitution is 1995, to date we do not have that law that explicitly provides for the termination of life. So we have filed a case in the Constitutional Court. And of course we lost it to 3-2 majority. And Justice Civil Court gave us a very wonderful judgment and stressed the point that ultimately Uganda as a country needs a law that regulates women's access to safe and legal abortion, setting boundaries and taking into account scientific progress. And that is highly commendable. And my Lord, we truly appreciate your efforts, and let it be on record in the Harare Principles that you are one of those that have advanced the movement. Thank you.
Thank you. Can I have the last contribution from the table?
Okay, thank you so much. My name is Pamela Msingwa from Justice for Children. So as I was listening, I just thought that we need then to strategize on how best we can actually balance the rights of children to access to sexual reproductive health rights. Especially in Zimbabwe, we are considering that we now have the Romeo and Juliet clause, where as a country we are acknowledging that children are having sexual intercourse even amongst themselves. If they are having sexual intercourse, they should therefore be able to access sexual reproductive health services. However, we also need to balance this particular right with their right to protection against adult sexual predators. So we need to strategize on how best as stakeholders we can then balance the two. Thank you so much.
Thank you so much for the contribution. And as I said, you were the last speaker. The program for the day comes to an end, and I'll hand over to my co-pilot, Salome.
What a day. How do you feel? Do we still have energy?
No, we still have some.
It's good. Okay, I'm not here to facilitate anything except to give a few announcements in terms of how we are going to manage today. First things first, we have a hashtag for the social media. It is hashtag Litigation Baraza 2026. Please ensure that you tag a Haki, Community Working Group on Health, Women and Law in Southern Africa, and any other people you want to tag with their consent. Consent is very important. And also, we live in a times, I remember many years ago, you had to visit somebody and part of the visiting was to view an album. That was part of the culture. That when you visit and you're a good visitor, they give you an album to view the pictures. Technology has since advanced. We no longer need to have the album physically. We have the pictures for you. Please feel free to scan that QR code and get those lovely pictures of yours. And also make sure that if you're posting somebody else's pictures, you have their consent to do so. And then lastly, we are going to have our dinner, which has awards, and we are going to be honored to host the Honorable Chief Justice of the Republic of Zimbabwe, Honorable Elizabeth Gwaunza, is joining us. So here is the plot. When we wrap up the day, I know some of us are dying to go and sink in our beds, especially people coming from East Africa and West Africa. For some reason, they fail to understand that Southern Africa has winter and it is okay. So here is the plot. The band has already started testing out the music. I went and danced like for 30 minutes. And I love to reassure you that the music is spot on. The eats are already there. The drinks are chilling. So what is the plot? The plot is when we end the day, those of us that would like to take the tea, it's there. But those of us that want those drinks for adults, they're already there. So the plan is to say, after we end, we go and start with a cocktail, with dancing, with enjoying, so that by the time the Chief Justice comes here and the awardees, we're already in the mood to celebrate for them. How is that plot? Is good? Sounds good? Is it feasible? Instead of going to a cold room, you'd rather stay outside and enjoy the warmth with company, the sun, music, and adult drinks. African touch. Okay, those that want to change, the ones that are not staying here, I was informed that they indicated that they don't want to go back. Those that are here, that want to change into the African print, please make sure you do it very fast because you're going to miss the enjoyment. There's so much enjoyment that is going to be there. And then lastly, try to network. We are here a total of 14 countries. Make sure you speak to people you do not know. Make sure you connect. Which countries are here? South Africa. Where are we? South Africa? Okay, maybe when I say the country, you stand up so that people can know who to target to speak to. South Africa. Let's clap for them. South Africa. Rwanda. Malawi. Kenya. Senegal. Nigeria. United States of America. Uruguay. Chile. Brazil. Jamaica. Colombia. Uganda. And lastly, our host, Zimbabwe. So, you have a lot of choices and options of people to connect with. Let's go and connect with the people. Lastly, I'd like to seek the indulgence of the two panels to take the group pictures. They didn't take their group pictures as a panel. I'll ask the first panel that had Chirisa, Dr. Brenda, and Sibongile to come and take their picture because you didn't take your picture as a panel. And then the second panel, the last panel, will also take their picture so that you're documented and also you have your picture for the panel. We seek your indulgence on that. Apologies for that. We also had Dr. T on that panel as a keynote speaker. We are missing Dr. T on this panel. Okay. They are all here. And feel free to pause for your picture. Okay. A funky one. One of the funky ones of video. Baraza. Dr. T, please stay behind because you are the moderator of the next session.
No is good. No. Dr. T, please stay behind because you're in the next one. Yeah, you were the moderator of the next panel. So you stay behind for the picture. So I'd like to take the opportunity to invite the justices, Justice Eva, Justice Biakatonda, Professor Robert, Catherine, and Lloyd. Okay, thank you very much. Okay, so we've come to the end of the formal session. Let's meet at the teas and at the dinner and see you later.